Good morning, ladies and gentlemen. My name is Jose Akaten Desempa from Mackay University Child Health and Development Center. Thank you.
Good morning, ladies and gentlemen. I'm called Rsel Albert. I work with Children's Rights and Violence Prevention Fund.
Good morning. My name is Dolores Were, and I work with Uganda Society for Disabled Children as Executive Director.
Good morning, everybody. Kwangamed is my name. District Inspector of Schools, Bujiri.
Good morning. I am Judith Nyakaisiki Tumsime from Uwezo, Uganda.
Hi everyone, good morning. I'm Dr. Miriam Laker Oketa. I'm the Country Director of Innovation for Poverty Action, but also an adolescent and parenting coach. Thank you.
Good morning, everyone. My name is Betty Okot. I work with Makerere University, the Child Health and Development Center. I'm a postdoctoral researcher and a parenting programmer. Thank you.
Good morning, everyone. My name is Catherine Chisache. I work with IREAD Uganda. Thank you.
Good morning. Good morning, everyone. I am Joan Kimbabazi. I am a girls' rights activist and the team lead of Gufashe Girls Foundation.
Good morning, everyone. My name is Lilian Nangunda. I work with Biggest Women Project Foundation. Thank you.
I salute everyone around. My name is Solomon Sebude Nambohe. I work as a country coordinator for Rsel Uganda. Rsel is the Regional Education Learning Initiative, a member-driven organization. Thank you.
Good morning. I'm Salvius Horendile from Makerere University School of Public Health.
Okay. Good morning, ladies and gentlemen. Kato Zaifa is my name, and I work with the Ministry of Education and Sports School Health Unit. Happy to be here.
Good morning, ladies and gentlemen. Kasule Muhammad. I work as a technical advisor on issue of school health and HIV, but at the moment, I'm standing in for my director, basic and secondary education.
Good morning, colleagues. Aji Saidi Nsamba is my name. Minister of Education and Sports, Guidance and Counseling Department. I also do coordinate mental health and sexual support in the education sector. I'm standing in for Commissioner, Guidance and Counseling.
Morning, ladies and gentlemen. I'm Henry Nsubuga. I am the Chief Counseling and Guidance Officer at Makerere University and Rsel researcher. Thank you.
Good morning. My name is Elizabeth Okello. I work with Mildmay and also the president of the Uganda Counseling Association.
Good morning, ladies and gentlemen. My name is Vivian Olga Kuda. I am a clinical psychologist. I am representing the Clinical Psychologists Association of Uganda as their president. Thank you.
Good morning, ladies and gentlemen. I'm Godfrey Kagai, and I work with Ogere Center for Mental Health.
Thank you so much. We still have a few members behind. Sheila, would you please help me?
Good morning, members. I am Joseph Soali, working with the NTV Uganda.
Good morning, ladies and gentlemen.
My name is Namaya Pius. I'm working with NTV Uganda.
Good morning, ladies and gentlemen. I'm Betty Mudondo, Speaker NTV People's Parliament.
Hello everyone, my name is Maria Jacinta Kanyange, NTV Uganda.
Thank you all very much. You're most welcome. You will notice there are some individuals we skipped, and this is the team that has worked behind the scenes to get us here today and ensure that we are taking care of the adolescents of Uganda. My name is Sheila Mwanje, and I work at JMAC as the head of advocacy, communications, and partnerships. My colleagues are here. Daniel already introduced himself. He is the head of our youth programs. And back here, you met some beautiful ladies who are supporting with the entry into the meeting. We have Rhoda, who is monitoring evaluation and learning officer. We have Susan, who ensures that everything at JMAC is running. She's our accountant. We have Yona, who's now on the technical bench, ensuring those who are joining us virtually are able to get in, and he also supports our monitoring, evaluation, and learning work. And we have Mabel, who most of you must have received emails from. She's there, small in body, but very big in terms of the work she does for us at JMAC, and it is a great pleasure. And there's someone who gives us guidance and leads us into ensuring that we are delivering the JMAC vision. And I will allow him to say hi, ladies and gentlemen, the Executive Director of JMAC, Dr. John Metana.
Thank you so much, Sheila, for the beautiful introductions. Good morning, all. You are most welcome to this event of launching our new program, Rsel. And in a special way, I also want to welcome our commissioner who has joined us, Dr. Annette Mujisha. You are most welcome. I hope we shall discuss more. Let me stop here. Thank you so much.
Thank you so much, Doctor. As a person who just recently was kicked out of the legal youth age in Uganda, you know, when you pass 35 now, you are an adult. It's a privilege, actually, to be a person who has spent over a decade dealing with youth. I feel excited whenever anything that is youth related comes up. I want to first of all welcome you again and thank you for taking your time to come and join us on the launch of our Rsel program. In my language they say apoyo wontutwal. For the other language I learned as I was growing up, they say mwebale nyo okujja, mwebale nyo tuwa obudde bwammwe. And then also I learned something very little from Sheila yesterday when she arrived from Nairobi. They say tumeshukuru, eh? That's what they say in Kiswahili, right? Thank you so much. I will leave it here. I think Sheila, please go ahead.
Okay, thank you very much. We have participants who are joining us online, and online we have Dr. Irene Nyamu, who is the Chief Executive Officer of the Regional Education Learning Initiative, a network that JMAC belongs to as a member in the Uganda chapter. You're most welcome, Dr. Irene. We are expecting more participants online from the Rsel Family Foundation, from the World Health Organization, from Butabika Hospital, and it's a great pleasure to have all of you here. And as we do our work, we partner with the media a lot because they are one partner who support us in amplifying adolescent voices, in carrying out conversations and influence and policy shift. We know to support adolescents, you can never work alone. And that's why all of us are here today, from CSOs, from the ministries, and all the partners that are here to support the cause of the Resilience and Social Emotional Learning Program. And I will welcome Betty Mudondo from NTV. We will be working with NTV to share a lot more on how our adolescents will be supported. We will reach out to some of you to participate in the conversations that we will be having. So before we get into our opening remarks, I will just invite Betty to speak to us for about 2 minutes about what happens at the People's Parliament that is spearheaded by NTV Uganda. Betty?
Thank you. Thank you so much, Sheila. I'd like to once again say good morning, ladies and gentlemen. It's quite an honor for me to be here. My name is Betty Mudondo, and I work with NTV Uganda. I'm a news anchor, but also a speaker of the NTV People's Parliament. So I'm very honored that NTV, or Nation Media Group Uganda, we are partnering with GEMAC and other stakeholders to be a voice out there, to be a bridge, to bring together communities and the different stakeholders as we discuss matters that are very important to us. Now, from the media, it will be very unequal of me to stand here and not give you a reason as to why we would like to come out very strongly to partner with all the stakeholders in pushing for this particular program. It's very important that this program is centering and looking at the mental health and sexual, reproductive and health rights of adolescents. At a time like this, we have had stories just last week. In a space of just 2 weeks, we have had 3 cases of children committing suicide, children taking their own lives. And this is all reported in the media. This comes firsthand to us. But remember, we don't only report the stories. We want to look for solutions. We want to understand what can we do better. Just to highlight a few, last week a school in Wakiso was closed after a child was found in the dormitory hanging. Very absurd for those that found the child. We also had people who was found dead still in a dormitory in Mbale. And then we had a primary 7 leaver last year who burnt themselves to death. These are children. These are our children, the children of a nation. And as society, we have a role to play. Parents, stakeholders, policymakers, and the media is coming out strong to partner with you. And NTV Uganda, Nation Media Group Uganda, and NTV Post Parliament is going to be at the forefront of moving with you across the different sub-regions in this country to make sure that the voices of these children are heard. So the questions keep propping up. Why this? Why now? But we are in a time where children are facing pressures, and they continue to say that probably they don't have enough disclosure. So what haven't we done right as parents? As a parent, as a mother, I speak strongly about this. I am passionate about this program because I would like for someone out there to one day speak to my child the way I speak to those children when we met them. Last year we had a chance still to work with GEMAC, and we were going across the different regions, and we went to Kalangala. We realized that some of these different regions face different challenges. But when policies are being made, it is a one shoe fit all. What they plan for Kampala is what is planned for maybe Kalangala. But you realize that have different issues. They talk about the fact that sometimes they can't access schools because they have to cross from one island to another. They give reasons as to why they're not going to school. So it's very important that today as we sit in this room, we get a chance to also speak from the minds of the little ones. I am very honored, and I would like to say that once Nelson Mandela said, the true character of a society is seen in how it treats its children. And because we're in this room today, we are a true character of the society today because we are here to speak for the young children and to make sure that we are the voices that are going to reach on ground and enable these children become the next.
Thank you so much, Betty. Need to come together to ensure that we are speaking of the issues, challenges, and even the successes of the programs and interventions that we carry out happening. I just want to confirm with those who are online, can you hear us? Yona and the technical team, please confirm that the team online can get us clearly. Is everything okay? Okay, yeah. I am told they can get us clearly. And before we get started, we have a team that worked on the Rsel program and understands the background of what was put into it to bring us here, and it will be great for us to hear a few remarks on how this came to be and ensure that as we get into understanding what the program is about, we understand the background. And it is my pleasure to welcome Dr. Annette Mugisha, who is the Commissioner Teacher Education and Training Development at the Ministry of Education and Sports. And we're also privileged to have her serving as the Vice Chair of the JMAC Board of Directors. Dr. Annette, you're welcome. Let's clap as she takes the podium. Thank you.
Thank you very much. Ladies and gentlemen, I want to request that you allow me to ride on the protocol that has been introduced from morning. Good morning, ladies and gentlemen. I want to begin by saying I'm happy to be here in front of the, can I call it, strong bricks that we think are going to give us a strong house. Today, ladies and gentlemen, the adolescents, the youth are privileged to have the whole world in their hands when they are walking, when they are sleeping, when they are seated as we are. But I want, as we discuss the many things that we are going to discuss today, how best have we used the availability of this world in our hands? What is it that we are proud of, that we were born in the 21st century? That you're not like us of the 20th century? What can we do so that we are better than the 20th century and the previous centuries? I want to say that has been unfortunate many times that people who have gold in their hands, they don't see it. The neighbors see it. And we who are privileged to have the gold in our hands, the unfortunate part is that we always see it when it has gone. And then we live in the word, I wish. I wish. If we reflect, there are many situations where we say, I wish, in this house. If we had time and we said, let's get papers, stickers, and write, you would find that we have so many I wishes. People will come and say, yes, you have a nice voice. One comes in a room like this, sits, and says, they will not hear me until when I go out. But you have a very beautiful voice. Now, if I want somebody to say something very well with a nice voice, how will I pick you if we have sat here and we have not spoken any word until the end of the day? Having gold in our hands, and we don't see it, and other people are seeing it, and then later on, we are in our wish, I wish. As we say that Youth is the foundation or the strengths of any country. We also say that the youth must be educated. When I'm talking about education here, I'm not meaning the books. There are people out there you know. Still, if we are to give testimony, you would say, he never studied, but the things he does, the things she does, wow. That is education we are talking about. The education that we talk about are in our hands. And in the hands, we can either, and they make a door. This door, you can close it, you can open it. We have the powers to decide which decision to make for our future. Like I have said, how do you use the talent that God gave you? How do you use the opportunity of the people that you live with, you study with? Your parents, as a youth, put you in a very good school. What opportunities have you used from this big school which has very many powerful people? In this room, we may be having, some people have very powerful OBs and OGs, and others have, I have a friend who used to say, I did not go to a school. There are people who went to schools. But each one of us, whether you went to a school, whether you didn't go to a school, I don't know what we call those ones for some of us where we went, you have OBs and OGs. What do you gain from those OGs that you have? During the time when we were graduating our PhD, the person who came to usher us to the world of PhD said there is graduation and there is graduation. And we first said, so what is the difference between graduation and graduation? And he told us that as we graduate, there are things we are going to do, but are also things which have been working with you, which you are going also to ride on to use the strengths that you have gotten as a PhD graduate. We are here. In the introduction I've had, we are in different places. We have different opportunities. And most especially of talking to our fellow adolescents, youth, or the sisters that are out there. What do we talk to them? From the experience that we have, what do we advise them? I told you that this person said we are going to ride on the strengths that we started from P1. And he told us that as we graduate at all levels, you have graduated as an accountant. But remember in class, every pen that got lost was stolen by you. And these people, you are going to go to the bank looking for the job. You are going to find one of them, a bank manager. And he looks at you and says, is he now a highway robber or he stopped doing it? On the way we started, as we graduated, there are many things that we found them. Did we make them as useful thing in innovation? That's so. As you sit on a computer, do you look for mute pictures? Or you say, by the way, as we listened yesterday, this is what I heard. How can I innovate something related to the messages I heard yesterday? And he told us that you have graduated and graduated, meaning that he was looking at the graduation from some of you, some of our friends who have been in nursery. From nursery to PhD, there are innovations that you should be having to give to the world. We now notice that our adolescent friends, they experience a lot of anxiety, stress, violence, and social pressures in schools. In this room, we agree that sometimes we would be going to read and say, hey, you are reading like you are an orphan. Meaning that people who read are what? Orphans. So those who are not orphans, what do they go to school to do? Because I thought we go to school to read. And I want to tell you that somebody can put her pleasure and his pleasure on only this statement. And then he says, now I'm going to read again. Mudondo is going to see me and will be asking me. Now I'm going to read again. John will see me and be asking me. Okay, today I will not read. But remember, for us in class, we have different ways of learning and understanding what we learn. There are some people who go in class, as I'm talking, you listen and you catch up. There are others who have to first go back, read notes, and be able to understand what the teacher taught. Now, if you start hiding from Mudondo and John, who will ask you, you are reading like you are an orphan. That means if you are this caliber, then the school is beginning to dwindle. Very soon you find this adolescent has dropped out. When we go to class, we have also discovered that our teachers have an issue. We go in the class and we are in the subject. And we forget that these learners we are talking to, the subject knowledge you are giving them is going to take them or lead them somewhere else. And the teachers never go out of the 4 rooms as they talk to the learners. It has also become a problem, because it is catching up with our challenge in mental health. At the end of it, you are gone. The teacher never tells you that you are learning this chemistry. But you know, as we learn to mix different things, tomorrow if you don't become a medical officer, you can use the knowledge to make soap. You can use the knowledge to do X, Y, Z. So the learner looks at you as you talk and says, the way I see, I cannot be a medical officer. So I think this chemistry is not useful to me. Why? Because the teacher is in subject, never goes out to go to the community to let this learner know, when I go out of this room, what is it that this knowledge is going to help me. Again, if we had time and we shared, you will find that most of us went into just because I admire the way Mudondo leads. I am going to be a journalist. But the rest doesn't know. He doesn't know how Mudondo became a good speaker and organizer and can lead a parliament, but just wants to be a parliamentarian. So those of us who are able to talk to teachers, I think we need to make sure that we let the teachers know that it should not be subject. I want to say that schools have a lot to support in the development of a desired country. And in a country like this, where the parents, we are running up and down, you leave the home, you leave the children at 7 and come back at 7 when they are sleeping, you just touch at them, I love you. Maybe he's hearing or he's not hearing, you just touching, he's not feeling you. The schools now remain at the center. And as we get time to go to these schools, I've seen most of you, as you introduced yourself, sometimes I've seen you in schools. Let's remember to talk to them. Let's remember to let them know that where your parents are not, the school is standing. And therefore, listen to them and pick something that will make your future. Emotional well-being of late has become a challenge to all of us at all levels. Last year, I remember a child who had to take her life because they changed the school. And in that school, she had a boyfriend. And you say, really, what short way of looking at life do we have today? People go to America, come back and find their fiancé in Uganda. People go to Uganda and go to America and get their fiancés. But they tell you go to Chitant, the fiancé is in Kororo, and one says, me, I have to die. There is a lot that we need to do. To the researchers, to my colleagues in guidance and counseling, but at the same time, I want to say each one of us in this room, because we have an opportunity to talk to people more than one, let's be teachers. And let people know that we should stop being myopic. The life that you're going to lead in the many years God is going to give you to be taken in one moment, because one has said, you know what? You are not going to go back to this school. You know what? I no longer love you. Many times these things have happened. We need to let the adolescents and the youth know that these things are happening because God has a plan. Because maybe God saw that this man, this woman was going to be a problem to you. He brings a situation that will make him tell you, I don't love you anymore. We need to let them know this when we get an opportunity to talk to them. That it's painful, yes. When we become sick, we don't look for medicine to cure us. We look for medicine to heal us. So can we help these learners? No. Can we help these adolescents? No. That one is also sickness. Let's look for medicine. Instead of killing us, we look for medicine to heal us. Ladies and gentlemen, we need to make the adolescents know that they are our hearts. And if our hearts are disturbed as parents, as elders in the country, we die. Many parents that you have seen who have grown and reached around 98 and above, if you look around, you will discover that their children are at a certain level. There is nothing that kills a parent very quickly like seeing how disorganized the children are. And every time we get an opportunity to talk to these adolescents, let's let them know that they have the key to making their parents go quickly or live longer. And above all, we also need to make them know that they are the strengths and the foundation of any country. Uganda without the adolescents, Uganda without the youth, there is no Uganda tomorrow. You have seen many countries looking for workers because they decided to make plans that were beyond plans. It's because they reduce so much and they have too small number of adolescents that they no longer have the workers. So ladies and gentlemen, I want to thank everyone that has made this day come. I want to make everybody that has made us sit here. I want to thank you for having honored the invitation. And I want to let you know that it is not by mistake. God has a purpose for you being here. And we shall be grateful if we hear somebody giving a testimony. I would be mistaken if I said all I'm talking now, people are taking it as sense. But at the best of my knowledge, I know there will be somebody who says that word inspired me. Last as I sign out, I want to let you who are here be my, should I call it my pipe? The pipe from me, taking water from the source of water to the point where I want it, to the learners. Another case that makes people hang themselves is because what they wanted to get, they don't get it. Can can you let them know that if you wanted to get 4 points at PLE and you don't get 4 points, it does not mean the world has ended. Senior 6 results are coming out on Friday. If you have not made the points that you wanted to have, it does not mean the world has ended. The beauty is God created this lovely world with a space for everyone. If we come to education, we have all levels. We have people who move slowly but sure. I always tell my friends that for me, I moved slowly but sure. But also, God knew that there were people who have a lot of speed. They can run and run and run. So they can move faster and where they are supposed to be. In athletics, we have those of 100, we have those of 400, we have those of long racers. You know that. And our adolescents must know that we have where to fit. When we come to schools, you see how they are. There is a school for everybody. So if you don't make it the way you wanted it, take the other longer route. And do you know what I mean? For example, for me, I started from a certificate. But I will tell people that I am proud to say I started from a certificate and now I have a PhD. If I am not your example, then you don't have an example in education. That you can move slowly as long as you know where you want to reach, you reach there. But you must have a goal. So that you are differentiated from the cavella, where the wind comes, it is going this side, it goes. As it has arrived there, the wind goes this side, to go the other side. If it is this chair, the wind cannot take it everywhere it wants. It will only go by you lifting it to where it is supposed to go. Thank you very much. Have a lovely day. I will be happy to have you somewhere for any word if I meet you. Thank you for inviting me, J-Mark.
Thank you so much. Thank you so much, Dr. Annette. Have your gold and notice it. Slow but steady. When you have the vision, you will definitely get there. And I think this really just reiterates our vision at GMAC to ensure that all children and youth learn, achieve, and thrive. The journey might be longer for others, shorter for others, but in the end, we see to it that we are achieving our mission as an organization to support the adolescents in Uganda and beyond. Thank you so much for sharing the powerful remarks, and I hope we all get to sit and reflect on the words that the Commissioner has shared with us as we plan to execute the work under the Resilience and Social Emotional Learning Program. I wish to acknowledge people who've joined us. I know online we have representatives from the Uganda Media Center, a representative from the Africa Population Health and Research Council. We also have teachers from the districts that we will be working in. I know Joseph is online. We also have the Ministry of Education and Sports. We have the Communications Officer who is also online. Thank you all for joining us. And I also see in the room members of the Regional Education Learning Initiative Uganda. You're most welcome. Uwezo Uganda, Building Tomorrow. I see the Uganda Society for Disabled Children. You're most welcome. And keep on interacting with the conversations that we will be having, and note down your questions. We will have a Q&A session where you will get to ask and understand the Rsel program even more, and also share your input on areas you feel that we might have missed something and it needs to be included as we commence this work, because we do not have everything figured out, and adjustments are always welcome as we work together to support the Ugandan child. And at this point, it is my pleasure to invite Mr. Kasule Medi from the Ministry of Education and Sports. He's here on behalf of Commissioner Dr. Cleophas Mugenyi to share with us a keynote address on why intersectoral action for adolescents is important in this very moment. Mr. Kasule, you're welcome.
Colleagues, once again, good morning. Good morning, Kasule Muhammad, as the moderator said. Yes, and also allow me also to ride on the protocol that has been also mentioned. But again, also I need to appreciate the good remarks from my supervisor, Dr. Annette. Thank you so much for those good opening remarks. They are giving us an insight, especially in understanding the issues that are affecting the adolescents and young people within, in and out of school. Colleagues, I'm standing in here for my director, basic and secondary education, but at the same time is a commissioner for basic. And allow me to read his keynote address verbative. Ladies and gentlemen, I salute you and appreciate your commitment to the cause of supporting the adolescents and young people by giving them the best chance to excel in life. Your presence at this launch of resilience and social and emotional learning to address mental health challenges and improve the sexual reproductive health and rights decision making among adolescents in Uganda is a clear testimony to this commitment. The launch of Resilience and Social Emotional Learning Initiative comes at a crucial time as our country is concerned with the significant health challenges that are affecting our young people. These include alarmingly high rates of teenage pregnancy, colleagues, as you know, escalating mental health issues, substance and alcohol abuse, and also increasing in cases of suicidal, which I think has also come out from one of the previous presenter. It is imperative that we tackle these urgent concerns, both urgency, compassion, and creating a supportive environment for our adolescents and young people to thrive in this country. One of the studies indicates that nearly in 5 Ugandan secondary students have signs of an emotional disorder. These conditions include anxiety, depression, post-traumatic disorder, and adjustment disorder, often involving excessive worry, sadness, and mood instability. This was a study which was conducted last year by Davison Ndiabika, 2025. So, which I think also I need to agree and have a consensus with my supervisor, what he has said, that some of the critical issues that are affecting mental health in our schools they are rotate around anxiety, worry, and sometimes academic pressure. So these challenges not only threaten our national education objective, contributing to low primary and secondary completion rates, because if our young people have mental issues, automatically we shall see poor performance, and at the end of the day, the completion may be also affected. But also importantly, it undermines the overall human capital, which is a critical to national development. Colleagues, as you know that education, we are the chair for human capital development. So this also necessitates a multi-sectoral saturation approach, where in all relevant sectors, including education, health, Ministry of Gender, Ministry of Local Government, must collaborate effectively to tackle mental health challenges and improve the reproductive health and rights of the young people and adolescents. And at the end of the day, we'll be able to see the better well-being of these children and also being holistically developed. So a multi-sectoral approach aligns with the human capital development, as I've said, through a program-based approach. This programmatic approach aims to improve the well-being and productivity of Ugandan population through an integrated intervention across the education, health, and social protection sectors. By addressing these interconnected areas, we can create a more resilient and prosperous society. Then education has developed a national sexual education framework, a national framework on education for health and life skills, which was a previous called National Sexual Education Framework. This is one of the key documents that was developed in 2025, and it aims to equip young people with research-based, age-appropriate information on optimal health, essential life skills, and the core values for personal well-being and national transformation. Colleague, this is one of the critical documents the sector really finalized last year. And just to inform you that MAMA is going to launch this document in April. And one of the core principles of the framework is the concept of optimal health, which prioritizes a complete spectrum of well-being, physical, emotional, mental, social, and spiritual. So this is one of the critical documents that, as I said, that is going to be launched in April. And I think it's an opportunity now, since now we are launching this critical program on resilience. It's one of the opportunities that the project can really take an advantage. So this holistic approach is at the heart of the framework, ensuring that young people, individuals are empowered to thrive in all aspects of life. So again, the sector also developed different guidelines on mental health. I know my colleague during the panel will be able to really articulate more. And also we have built the capacity of the teachers to ensure that they support young people who are undergoing a lot of mental issues. But again, also we have tried to integrate mental health into our school clubs and also other programs. So these efforts present a valuable opportunities for the project to leverage in order to ensure effective implementation of the program. So I take this opportunity in a special way to appreciate GM Education and Research Center in organizing this event. Today we are here witnessing the launch of Resilience and Socio-Emotional Learning program. As a sector, we are committed to support the effective implementation of this project and ensuring it has a meaningful impact on our adolescents and young people. I thank you so much.
As a person who engages more with the youth, there is always a few things you observe with the youth, especially when it comes to issues related to mental health. I think we are facing a very big challenge, especially because of the factors that surround the youth today. Especially the factors that surround the youth today. Most of us grew up in an era where certain things were not accessible. These days we have internet, we have social media platforms, and a lot more. And usually it is bringing in a lot of issues relating to mental health. I recently read somewhere where they were saying that maybe in the next 2 to 3 years we might have an increase in mental health cases. And some people were actually joking about it. We are saying maybe all of us in Uganda are mad at some point. But I think when we joke about these kind of issues, we take them as a joke, but at certain moments they turn out to become real and they affect us a lot. When we look at young children, growing up I never heard of a child maybe below the ages of 15 committing suicide. But today we are hearing such kind of issues. Maybe we need to put in much more effort. I thank you for being part of this because I feel the pain when I see issues like this on the news about a 15-year-old, 13-year-old committing suicide, and I ask myself, to what extent were they pushed? Or to what extent did they feel the pain to reach this level of saying, I'm committing suicide? Now, for the next panel, we are going to be having... Sorry? Okay. Yes. Mr. Hosea attended. Okay. Okay. For our next session, we are going to have a research evidence on parenting for adolescent resilience and the insights from the Parenting for Responsibility program in Uganda and Makerere University. Now, for the presenters of this session, we're going to have Ms. Caroline Namutebi and then Mr. Hosea Katende, alongside Dr. Betty Okot on this. So may I welcome Ms. Caroline Namutebi and Mr. Hosea Katende. Thank you.
Good morning, ladies and gentlemen. I am Katende Hosea Sempa with my colleague Caroline Namutebi. We are representing Dr. Sue Godfrey, who is the director of CHDC, who was meant to be here, but due to unavoidable circumstances, he couldn't. And also Madam Caroline, we are going to do a co-presentation because of some issues. So I'll hand over to her to introduce herself, and then we, as the IT team is setting us up.
Good morning, team. Happy to be here. God is good, and all the time, and that's his nature. Wow. Yeah, we thank him for the rains in due season. So my name is Caroline Namutebi Biekwaso, and I work with Makerere University Child Health and Development Center for the Families, Parenting and Child Health Program. So we are blessed to be in this position of sharing the work that we do at the center on behalf of the university, but many times on behalf of the Ministry of Gender, Labor and Social Development. Okay. So we said that we are from Makerere University and under the College of Health Sciences, and our department is called Child Health and Development Center, located right inside the hospital near the sickle cells clinic. We have several programs that we run as a department, and the family parenting and child health program is one of them. So the mission of the center is to promote the well-being of children and women in Uganda through a multidisciplinary and multi-sectoral research, teaching and training, and through strengthening of partnerships between the university, communities, and government. So that mission informs the work that we do. As we said, the program that we are going to be talking about is one of the 6 research programs that we have at the center. And the work that we do at the center goes beyond treating children, teaching doctors and nurses, but we do a lot of research around communities, around families. So, What fits into the meeting today is the Families Parenting and the Child Health Program. As Hosea said, this work is led by Dr. Sue Godfrey, and we have done several projects within this field. I will not go through all this, but some of us are aware of the Parenting for Respectability, which started as a study, but right now we are scaling it up in 5 districts in the country, but also in the region that is in East Africa. We also have several other projects that I will not talk about, but what informs our work? You know, when you look at the findings that we received from the VAC survey, which is already outdated, I know that the Minister of Gender is working hard to see that we do another survey. You realize that 59% of the girls and 68% of the boys have experienced physical violence in their childhood. And in East Africa, that is a high figure if you compare ourselves to Kenya and also to Tanzania. You also see that 35% of the girls and 17% of the boys have also experienced sexual violence. So now, when you look at us in this room, you can ask a question: how many of us were not physically abused? And how many of us girls were not sexually abused? And then you realize that 45% of the youth were involved in alcohol abuse. Then we had a 24% child marriage, and then 25% people having depression, as one of the moderators had mentioned. So these findings, and also considering that 56% of the women had already experienced IPV, needed us to come out with interventions, with research programs that can reduce these numbers and also make sure that our girls, our boys, and the entire family is safe. So drawing from the national parenting guidelines that we already have as a country, and also drawing from the work of the Inspire, we came up with a parenting program, because both work informs the work around parenting is very critical, because parenting feeds into health, it feeds into education, it feeds into early learning. And so when you do parenting work, you're able to address most of the risk factors that affect children and families in the country. So as this is just an illustration that talks about how we work. The work that we do is basically research to build systems and create conditions to achieve quality scale-up of evidence-based parenting and ECD support for the country. So we do research, and also we do systems and capacity building. I think we work with intermediaries, but we also work with government. So the Parenting for Respectability, which is already scaled up in Uganda by CHDC in 5 districts, by other organizations like CRVPF in 3 regions in the country, but also being scaled up in East Africa and Ethiopia, started as a pilot in 2013, where we just designed the program and delivered it with a sample of about 30 parents in Wakiso, Entebbe. And so findings from the formative evaluation informed the proof of concept, what we many times call the before and after evaluation. And that work was done still in the Wakiso district, but we had a bigger sample of 600 parents, and we did this work with SOS Children's Village as the implementer. So drawing from those findings, organizations like CRVPF and CTP decided to start the scaling up of the Parenting for Respectability before we did the randomized control trial. So in 2019 and 2021, we see organizations like CRVPF choosing to do an adapted version of the Parenting for Respectability, and also we see SOS continuing to deliver it in the different regions in the country. In 2023, 2020 to 2023, that is when we did the randomized control trial in 2 districts of Amol and Wakiso districts with a sample of 2,160 parents. So findings from that study were very good, with about 49% of less physical violence and about 53% reduction on intimate partner violence. So that is what informed the future. And that is the work that we're already doing with the scaling up of the program. Midway the program, we also started to do work with the parenting agenda, because as members of the parenting agenda consortium, we realized that as a country, we had very few parenting programs that were informed by evidence. At that time, even the parenting for respectability was not informed by evidence. We just had the real fathers. So it was important for us to come up with an agenda that can help partners start to reflect and, you know, get a breakthrough. How do we ensure that we have evidence-based parenting interventions in the country? And how do we make sure that we are all aware of who is doing what and where and when? So together with the Ministry of Gender, Labour and Social Development, that is when we did the parenting agenda, and I'm sure that some of us in this room are members of the consortium. Okay. So from the work that we did, we have done some publications. So these are some of the publications, and you can find them online. But also that is a resource that we use. It is a manualized program. So that means that it is a step-by-step program. It is not these programs where you just get an idea of what is implemented and then you deliver it. It is manualized, and those are some of the materials. We have a manual, we have a register, and those manuals are normally translated in different languages according to the communities where we are delivering. So those are some of the results that we were talking about. At the pre-post, we had 27% reduction of harsh parenting, and also dysfunctional partner relationships were at 22%. So those results are the ones that informed the randomized control trial, and for some partners to scale up the intervention. These are also the results that I spoke about, that at the randomized control trial, which was done with over 2,000 parents, we had a 49% less violence against children, a 51% less perpetration of intimate partner violence, and a 53%. These are very interesting findings, you know, compared to a program designed like the Parenting for Respectability, which addresses different risk factors, but also ensuring that both mothers and fathers attend the parenting sessions. Interestingly, it is one of those unique programs where you'll see many men attending the sessions. So we had 1,066 fathers attending the weekly parenting sessions, and we had 1,251 men. To compare the findings, we also collected data from the children, and so that is why we have 844 children. The children did not receive the intervention, but they did the study. They answered to the questionnaires at the baseline, endline, and follow-up. Continue. So these are just giving us some of the interesting findings, but just maybe to bring to your attention that to compare, because it was a trial, we had a comparison, a community that received just a lecture of this session. So our findings show that those that had received just a lecture, at follow-up, there was increase in violence as compared to those that who had received the entire program. Go. Okay. Now, from those interesting findings, we now did scale up of the program across the 5 districts of Amol, Wakiso, Tororo, Busia, and Nakasongola districts. And through the scale, we were able to reach 1,000 14,601 parents, and these are the parents who received the intervention in person, and were able to reach about 50,000 children. On average, each parent would register the number of children they have, so on average each family had about 4 children. And through the different interventions that we had for scale, combining digital and in-person, we reached 129,000 parents and caregivers, because we had a combination of physical and digital. Digital was radio programming and also signpost and billboard messaging. For the scale up of the intervention, we put in a study. We also did research at both baseline and endline, and we had a sample size of 1,650 parents who also did a baseline and an endline 6 months after the intervention. So overall, child maltreatment reduced, as you can see, by 71.9%. And so we are able to compare our results. At endline, remember we had a reduction of about 50%, and now implementing this parenting for respectability in a natural environment where you're not controlling factors, we still see a change of about 70%. So this means that the parenting for respectability is a program that we can adapt or adopt to as a solution for our parenting interventions. We also had the evaluation of impact for the parenting for respectability on ECD. And for why did we come up with the ECD? We realized that by having a generical program that were looking out for parents with children 0 to 17, there were other unique parents that were being left behind, and those were the adolescent parents. When I came in, someone was talking about the youth. These parents that will not fit into a group where the in-law is there. So we had to adapt the parenting for respectability for such a unique group. So the adaptation required understanding of ECD, understanding of parental attachment and bonding. We discussed growth, nutrition, and child development, how they can monitor their children's development, playful parenting, and child psychosocial stimulation. But also we brought in a component on gendered relationships. Much as many of the adolescents were still at home, as they are raising their children, it is important to pay attention to issues around gender. But also those that are married, it was very important for them to have a reflection on the norms and how can they navigate these norms to ensure that for the safety of the children. So we had a sample of 590 parents in this study, and it was delivered in one district, that is Tororo, out of the 5. So this means that we did a baseline, endline, and a follow-up after 12 months of intervention. I will stop here and allow my colleague, Hosea, to continue. Thank you.
Thank you so much, Carol. The basis of all this, if we are to build resilience, the family is the core. Minus the family, if we leave out if we catch them in the middle, then things may not go right. So parenting for respectability and such this, you want to catch them as early as possible from conception going forward. That's why we are focusing on the family. So what do the results show from the ECD intervention? Our assessment found that ECD focused intervention. Oh, tech team. Good, thank you. So our assessment found that this ECD focused intervention resulted in statistically significant improvement in early childhood development across all domains compared to the control group. I would like to look at the social development, the interaction between the parents and the child, the environment under which the child grows forms the basis upon which this child's growth is going to be positive and actually get to better outcomes. If at the beginning things were not right, then even when we try it at a later stage, things may not come out as we want. So that's why we have this study focusing on the ECD. We look at gross motor. PFR children scored 4.2 points higher at follow-up than control, with a significant intervention effect of 3.09. So across gross motor, fine motor, language, and composite outcomes, children of caregivers who participated in the PFR consistently demonstrated significantly greater development gains, highlighting the positive impact of strengthened parenting practices in child outcomes. Many of us are actually looking at how best do we prepare children for school. This is where it starts from. These are the results. And then we had another arm of implementation. This is Parenting for Respectability app study. There are some parents that we can't catch, me and you. When we call for community interventions at your village, you are not there. Weekends, you are traveling to the field. You come back late. So we are trying out a trial for the using the digital app. And the objective is to assess readiness, feasibility, and initial effectiveness of digital delivery or parenting for respectability. Can we use the digital era now to catch you? So this was in partnership with the Global Parenting Initiative, which provided access to free evidence-based playful parenting support to parents globally to equip them with knowledge and tools to prevent violence against children and IPV and enable children to realize their full potential. So in this study, we had 3 arms of delivery. We had the self-paced, where the parent, the person who receives, gets the information on his digital equipment, the phone, and go through the sessions. Then we had another arm where there was a facilitator taking this parent through the digital, how it works. And then we had the group-based where parents meet and then the facilitator takes through them. With this one, the results are yet to be analyzed. We are yet to go for the end line. So we don't have the concrete presentation about the results because the end line is not yet done. But so far, we had 309 participants, parents, participating in this study. The other arm that we are working on or worked with is the disability inclusive parenting. This came up when we were delivering the mainstream parenting for respectability. There is a group of parents that are left out. Those that are either living with a disability or those taking care of a child that has a disability. So responding to this, we aimed at adapting and piloting the Parenting for Respectability program using hybrid delivery, parents with disabilities or with children with disabilities. We had a co-adaptation, feasibility processes and lessons, and then quantitatively test the initial effectiveness. The manual you see on your left, far left, is the Parenting for Respectability manual, which was adapted now into the Disability Inclusive Parenting Facilitators Manual to cater for their needs. And then the last image is when the program was being launched. This we reached 160 caregivers with disability and caring for child with disability in Wachiso, this via in-person, WhatsApp, and SMS. And the results, what did we observe? The changes in DIP parenting practices. One, we observed meaningful shifts towards positive parenting, particularly among WhatsApp participants. Also, we saw physical punishment decreasing overall from 39.8 to 25.7, suggesting intervention effectiveness in reducing violent parenting among people living with disabilities. Participants reporting alcohol use at baseline had significantly lower scores compared to non-users. This is where our study is also observing parents with disabilities but are still taking alcohol. The shifts are not significant. But those that are non-alcohol users, the shift is significant. So this calls for more studies into this to see what's that is making the non-alcoholic user to see the importance of positive parenting while the alcohol user doesn't see it significantly. So we are still looking for more studies to see that we can understand this. But we are attending to people with disabilities or those taking care of a child with disability. How can we incorporate them within the interventions that we have so that no one is left behind? On top of that, as HDC, from the parenting agenda that Kara has talked about and the call from government and partners, there was a gap within the area of parenting that was identified. So there was a capacity gap. Many people are saying we are doing interventions around children, we are doing parenting, but each of us is doing it haphazardly. And when you ask for what is working, there's no evidence. And as a country, we are moving towards evidence-based interventions. What is working? What can be replicated? What's not working? What can we drop? So out of that call, we developed a parenting practitioner certification course, codenamed Science of Evidence-Based Parenting course, with the objective of building capacity of parents, parenting practitioners in the science of designing and implementing evidence-based parenting programs. We drafted the course. The course was approved by Ministry of Gender and College of Health Sciences, and we delivered the course in 3 cohorts, starting in March last year, ending in July last year. Overall, so far, we have trained 142 participants, including government officials, NGO practitioners, faith-based institutions, and others. The pictures below are those ones that transpired during the course. But this is what is most interesting for evidence. We gather data from the participants before starting the course and then after starting the course. So when it comes to the different variables, confidence in designing an evidence-based parenting intervention, it's only 14% who were confident that, I can do it. And then not confident were 33.1%, and 8.5% had no idea about what evidence-based intervention is all about. Then clarity, when we talk about confidence in leading and implementing a program, 34.5% could not, but after the course, at least 49% would say, yes, I can now. And then when it comes confidence in leading adaptation, picking another evidence-based program, and we take it on, 26.1% say they couldn't, but after the course, at least 37% confirm they can. So in this field of strengthening parenting, this course is actually one of the strategies we are using. This slide is about the course, people that launched the course, the permanent secretary, then we had the King of Iteso and others, and then participants. What other things have we done so far? We've done the building of architecture and tools to support standardization of parenting. Under this, we participated in Parenting Agenda Initiative, where we have over 70 partners on board, and some of you are part. which also resulted into the National Standards for Parenting Programs, which was recently launched by the ministry to strengthen the standardization of parenting in Uganda. Under this is the launch, and then strengthening parenting and empowering. These are statistics of how it works. We have the data hub now, where we are advocating for all partners that are doing parenting work in the country. They register with the parenting agenda. They register their interventions to avoid duplication, and then creating visibility, who is where doing what. So we stop reinventing the wheel, because quite often many programs have been funded by government, by international donors. Another one comes, does exactly the same thing. But if we know who is where doing what, we can complement each other, and then maybe we see where to go and where not to go. So this data hub is open to all partners that are within the parenting space. They register with Ministry of Gender. It has different sections, programs that are ongoing, those that have closed, how many people reached, which district, how many women, how many men, how many children. So that at national level, even at policy level, actions are taken based on evidence of what is working. When you come, I'm going to Amur with the parenting intervention, the ministry should be able to guide you. There is CHDC, there is SWAND, so can you work with them? So this is the parenting data hub, which was launched on the 30th of July 2025. We have another study. Now this is a study about feasibility on refugee early learning, playful parenting project in Palabek, Amul, which is led by Dr. Betty Okot. And this is looking how do we integrate playful parenting for school readiness. We know what refugees go through, and even our own children. How ready are they? How can they use the locally available materials to prepare children for school? This study, we are yet to collect the end-line data, but once there, then we shall use it as evidence to show what is working and what is not working, and anyone can pick it up if we need. So as Carol said, our work goes beyond Uganda right now, with working with CTP, which is Center for Transformative Parenting, and CRVPF and Poticas. We have extended in Kenya, Tanzania, and Ethiopia, still carrying the same message: parenting as a core for societal development. If the family is not strong, maybe other things might also be shaky, because normally here they say wakulirawa, asking which family raised you. If your family was not good enough, then your character is questionable. So CTP is doing quite a lot of work with CRVPF in Kenya and Tanzania and Ethiopia, and now we are scaling PFR in 30 primary schools in Tanzania, and there is also another program for adolescent mothers in Kenya and Tanzania to build their resilience and their parenting skills. We've done quite a number of networking, and thank you for inviting us. Networking and advocacy is key in program implementation. To share what is working, to share your work with us, with others. The issue of Naswa Mukange is no longer working. We need to advocate for this. So JMAC, thank you for inviting us, and these platforms are quite good for us too. So we've done quite a number of advocacy, newspapers, online, and in meetings, virtual meetings and physical meetings, international, regional, and national. So one of our advocacy meetings that we attended last year was the Bogota meeting around ending violence, where the government of Uganda with the CHDC presented, and the government committed and signed to end violence against children. So part of the issues that we are following up with the Minister of Gender is how are we actioning this such that our work in prevention of violence against children is drummed up so that by the next time we meet, Uganda has taken other strides. What does this mean? Whatever you're doing in your organization and is plugging into this needs to be drummed up with the ministry so that we can have a consolidated approach and then same communication. Because at times we say Uganda is very worse off, and others say, oh, we are making strides, but we need the same voice with evidence that things are working. So we also had a meeting, the one above, a WHO meeting, still looking at parenting, violence against children, and what we can do as an organization and as a country to see that we contribute to ending violence against children and then increase male engagement in this sphere. So these are the different advocacy, government interest, understand full range, different meetings that we have attended, then materials at district level. We always meet influencers to see that actually at local level our work is accepted by the leaders but are still supported at local level. These academic and public engagements, we have engaged at different levels. As I've said, we had a symposium and the other meetings that we attended as a center. All this is around dissemination. We have now started publishing a newsletter, a quarterly newsletter, to still share our work and our evidence. And in this, we share our research findings and other community engagements with different people. Dissemination through media, I've talked about it. And then we have several publications which you can access. They are on different publication houses where you could research through this and then strengthen your intervention. So when we share this, there are several ones. One is about designing and evaluating, and then different aspects of parenting. So our niche or our area of specialization is strengthening the family at different levels and garnering as much support as possible from different spheres, using research findings to actually see that this area is funded. And I might say at last is if you want a child that can take the right decisions, a child that can manage himself or herself, a child that can make better relationships and can manage the social interactions, don't leave out the family. Because the family is the core for social, moral, and all other factors that can influence the adolescent. As you think about the adolescent, think about where this adolescent comes from. This could be a good area. Thank you so much.
Thank you so much, Mr. Hosea and Madam Caroline, for this insightful publication and also presentation. You see, when you talk about a great university in this country, Makerere University has to be mentioned, isn't it? So that definitely means that whatever has been presented here is solid. Of recent, I learned a new word where I hang around in the ghetto with my youth. There's a new word called gumite. So that means that what has been presented here is gumite, okay? There is something I wanted to talk about briefly. It's about raising of children. Recently, I came across something that was saying, we like to ask ourselves this question. Is that also the son of this one? How come this one is behaving like this, and how come the other one behaves like this? They're always those ones we consider the black sheep of the family. But do we also consider how we raise them? Because certain moments in our lives will also determine how we shall raise the children. Imagine the time when you are not a busy person, you are an unavailable parent. When you grow career-wise, you might not have time for the next person. That would mean the firstborn was given much love when they were growing up, isn't it? The secondborn might not have that time. At a certain moment, maybe financially things are going sideways and you are very aggressive at home. So the firstborn enjoyed your times when you were a peaceful person. The second one might not enjoy that peace, okay? So the aspect of family is a very important thing, something very important in the raising of the children today. So we are asking ourselves, are we becoming good parents? Are we showing our children the right direction? Are they able to survive? Because when we talk about resilience, are they gumite as well? Sometimes we are raising people who cannot actually face disappointments. Because you look at the situations that we are facing right now, you tell a child, I'm not giving you pocket money of 1.5. It was 1.5, 1.2. Recently, then I had the person wanted to box the father. In my time, they give you 5K. You pray that the 5K takes you up to midterm when they come to visit, okay? So something about parenting is, let us be good parents to these youth such that tomorrow we have people who are able to take care of us also when that time comes. Thank you so much. I think let me hand over to Sheila to say something.
Thank you so much, Daniel. And I believe in this room, nobody is gumite. We are all very ready and aggressive to handle the matters that are ahead of us. Thank you all for being very amazing participants. We have people who've joined us online and even in the room as we went on. Someone joked that I brought the rains from Nairobi. I'm not so sure if that's the case, or the rains from Kampala are the ones getting back to Nairobi. I welcome Mr. Modan, the country director for Uganda, Star Uganda. And I also see several faces in the room under the Regional Education Learning Initiative. Thank you all so much for joining us. And the other CSOs and international organizations that have joined us. And the teams online, this is being captured by NTV Uganda, the Government Communication International Center. So the big brother is watching. And we also have the Daily Nation for Uganda. So let's all keep the conversation going. Online, I see Dr. John Mugo from Zizi Afrique Foundation. One of our big brothers. We always say as younger brothers, we keep learning and following what other organizations are doing, and we are privileged to be learning from the Zizi Afrique Foundation, who've gone ahead to do a lot of work on advocacy on matters, values, and life skills for learners and adolescents. And we will keep on tapping on the knowledge that they have gone ahead to provide. And from the presentation by Hosea and Caroline, you can tell that evidence is at the backbone of our work at JMAC, since we are also a research center. And we dwell on evidence before we carry out any interventions. I also welcome Mr. Patrick Walugeme from the International Development and Research Center, IDRC, who has joined us online. Also informed that Rosemary Oyolo from Poticas popped in and popped out, but we appreciate that you're all making time to join us. And in absentia, I would like to recognize the Echidna Giving team, who are providing all the resources that are enabling us to carry out this work, and the World Health Organization, who are our technical partners, ensuring that this work is really getting to the teams that we need to get to. And because it's already 11 and people are stuck in traffic jam, I know you'll need something to warm up your systems. We will take our tea break, and the tea is right here, so it will be our working tea. And after the tea, we will have an interesting panel discussion, and then our executive director will also be sharing a lot more about the Rsel program. So sit tight. Keep listening. We look forward to the questions. We look forward to your additions to the work that we will be doing under the Resilience and Social Emotional Learning Program to support the very young adolescents who are between the age of 10 and 14 years in Uganda. And to do that, I would love to have you do a very quick exercise. So ensure you have some space, because as you get up, after that, you will go get your tea. So try to ensure there's space around you and that you will not hit anyone when I ask you to do what I want you to do in the next few minutes. I will read statements, and if you believe you have done any 3 of these statements, when I read it out, will you please stand up? So if you believe that adolescent mental health needs more attention in Uganda, please stand. Thank you very much. You can get back to your seats. There's something I want to say. Then now, if you believe that schools should teach social and emotional skills, please stand up. Thank you very much. I think we are in agreement that there are things that should be taught in school, but I see there are some people who are 50-50 on this matter, and they'll be sharing more with us on what they believe would be. And with this, maybe you can keep standing. If you have ever mentored a young person, please stand. Thank you very much. I was going to be surprised if the founder and CEO of Mentor Leadership Institute was not going to stand, and I was going to have several questions on how mentorship is going on there. Thank you all very much. Shall we please serve tea and get back in readiness for the panel session that will be led by Dr. Betty Okot, who is a very passionate person when it comes to adolescent well-being, and I hope you're very ready to listen to this conversation on what matters when it comes to intersectoral action for adolescent well-being and the alignment in education, health, and also policy systems. Thank you. from the presentation by Mr. Hosea and Ms. Caroline. I think we shall combine a question and answer session after the panel discussion. So Hosea and Caroline, please stay ready to respond to questions that we may have as we finish the panel discussion. And I will invite our moderator for the panel discussion, Dr. Betty Okot. Please join me here and call your esteemed panelists for the next session. Thank you.
Good morning once again. Can you all hear me? I hope I'm audible enough. And I know some people are still continuing with break tea, which is okay. Thank you so much for joining us for this launch. And I'm very privileged to be hosting this panel of esteemed experts in the different fields. In no particular order, I'm going to call people and read their profile. When I call your name, please walk and take your seat as people hear about the work you've been doing. First, I'm inviting Mr. Albert Asimwe. Albert is the Regional Program Coordinator at Child Rights and Violence Prevention Fund. Albert supports partners to co-create programs and intervene in violence prevention or preventing violence against children and young people. He works for CRVPF, and their role is to build partners' capacity and institutional development to support parenting work, largely in the East African region. So Albert, you're welcome to the panel. We clap for him. Thank you. The next panelist is Haji Saidi Nsamba. Let's clap like we mean it. Yesterday I was somewhere and I had to take people through a masterclass in clapping. Maybe we are going to come back to that very soon. Yes. Mr. Samba, Haji Samba, is a teacher and counseling psychologist, coordinator at MHPSS in education sector. Is principal education officer and guidance and counseling in the guidance and counseling department. Has a graduate certificate in sexual and reproductive health programming, I think, from the Royal Tropical Institute, Amsterdam. Part of core team that developed the national framework on education for health and life skills. He's extremely passionate about young people. You're welcome, Haji. Again, my masterclass is coming. It's on the way very soon. The next panelist is Dr. Vivian Olga Kuda. Dr. Kuda is a Ugandan clinical psychologist and director of Minders Wellness and Psychological Center in Kampala, where she provides clinical services and consults with educational institutions to support students with learning and behavioral challenges. She serves as the president of the Clinical Psychologists Association of Uganda, advancing professional standards and mental health advocacy. She's also the general secretary of the Uganda Counseling Association. Welcome, Dr. Kuda. Then we have Mr. Hosea Katende, who is my colleague at the Child Health and Development Center. You've just seen him present the work that we do at the Child Health and Development Center. Hosea is a seasoned development professional with over 20 years of experience in education and social development, specializing in child protection, social-emotional learning, and scaling evidence-based interventions. Currently, he serves at as the Scale and Capacity Development Officer at the Child Health and Development Center, Makerere University, especially on the Families, Parenting, and Child Health program. In his position, he drives the reach and impact of the Parenting for Respectability intervention, most recently coordinating a comprehensive course on the science of evidence-based parenting interventions to explore pathways for national and regional scale. His work involves close collaboration with government ministries, especially the Ministry of Gender, Labor and Social Development, local governments, and international and local partners. Hosea, you're welcome. Actually, his nickname, which he may not want me to tell you, is Mr. Headmaster. He got that name when he was running the course. So, Hosea, you're welcome to the panel. Last but not least, we have Dr. Miriam Lake. Dr. Lake is a medical doctor, a senior health and development researcher, formerly director of research at Give Directly, currently country director for innovations for poverty action, an international development organization focused on generating evidence for practitioners and for government to guide evidence-given policy decisions. Dr. Lake was in February 2026, just this year, recognized by the Washington Post as one of the 50 people, mark this, one of the 50 people expected to influence the world. She is also a parenting, adolescent, and young adult coach. This is no small step. So, to all the esteemed panelists, you're most welcome. I want to step a bit from the moderation and mention a few things. Then we can start. During the presentation that was given by Caroline and Hosea, I believe you remember a mention of disability inclusive parenting program within the Parenting for Respectability program. That is one of our adaptations and satellite studies. We are honored to say part of that study, one element of that study, was actually sponsored by Innovations for Poverty Action. We are very grateful to them for that support, and we are looking forward to further engagements. When Carol and Hosea were talking, they said a lot of things about the Parenting for Respectability program. Some of the things that stood out that I thought we could have a little bit more to say about is how the Parenting for Respectability program is delivered. Normally when we start the intervention, because it's a 16 weeks program, we single men out and women are singled out. So the first 9 sessions are single sex. There's a logic to this. Then from the 10th to 16th sessions, we mix the participants, men and women. Couples are free to come together. One of the reasons is to allow us to test if the gender dynamics are beginning to shift, if certain stereotypes are being dented, and our results show things are working. Then the relapse study for refugees is not happening in Amuru. It is taking place in Palabek in Lamour district. And we have a strong global presence working with the Global Parenting Initiative. And the WHO in 2024, also recognized the Parenting for Respectability as a model program for scale up in Africa and beyond. So thank you so much once again for joining the panel. I have questions that will be asked to each one of us based on your experience, based on your expertise, but feel free to talk, to cite examples from everyday life. Feel free to say what you think is going to help us understand the need for social emotional resilience, especially for adolescents. Allow us understand the importance of supporting adolescents to understand, to appreciate mental health, but above all, to manage and make correct decisions about their sexual and reproductive health. Again, the questions will start in no particular order. My first question goes to Dr. Kuda. Thank you so much. Dr. Kuda, please tell us what practical opportunities you think exist now to strengthen the integration of resilience building, mental health, mental well-being, and sexual and reproductive health into Uganda's education and health systems, and what would be effective intersectoral collaboration.
Okay, thank you very much. I believe
Thank you.
To start with is to say we have existing policies. I was looking at the Child and Adolescent Mental Health Policy of 2017 by the Ministry of Health. We have existing policies already, and that's just one of them. We have infrastructure, so we have schools and institutions to already work in. We have human resources, and even when human resources is still limited in terms of meeting the demand, we have somewhere to start from. We also have the people who need the services. But also to mention that even when we have all this going on, I'm already partly getting into the next part of the question, is to say that we have a lot going on, but many of institutions and people, partners, ministries working in silos. And I actually thought that since we have people from the Ministry of Health, Ministry of Education, I don't know if there's anyone from Ministry of Gender, is to ask who is bringing all these people together to exploit those opportunities. Because if there's no leader, regardless of what is available, we shall always say this is not enough, this is not enough. And at the end of the day, we have cracks only growing bigger. So we have the need. Do we have young people in Uganda that make up about 70%? Yes. Do we have personnel that should provide services? Yes. But who is bringing all these things together? Even when we talk about funding, one would ask, there's a time we conducted a study to check how much Uganda spends on HIV/AIDS. So one would say, how much money do we spend on child and adolescent mental health? But because we are working in silos, no one will ever know. No, because no one at the end of the day puts us together. Next, second part of the question.
Yes, the second part of the question says, And what would effective intersectoral collaboration require?
Okay.
Now that people are working in silos, you've been able to identify that. What do we need to network them, coordinate them, to work together?
We need a leader. We need a leader. If there are three main entities, if we have Ministry of Gender, Ministry of Education, Ministry of Health, who is spearheading this thing? Hosea talked about families. A man spearheads the leadership in a family. So you have someone that you can hold accountable. But if I ask in terms of child and adolescent mental health, who should we hold accountable? Because the Ministry of Health will say, I'm doing this part. But if it's something that I don't know, then I'm really happy to know who is leading this. We need a leader. We need to stop working in silos. We need to integrate the services. Actually, the opportunity there would be that once we work together, then these services would be integrated. We would have one-stop shops for young people. But if you have to tell a young people, go here, then after that, go there, what are the chances they are going to do that? They will go there, and after that, they will dash off. I used to go to the Naguru Teenage Center when I was a young girl. My mother is a retired nurse, so she would force us to go and test for HIV. But then there are so many things that I would find in one place. Apart from Naguru Teenage Center, where else do we find integrated services? So integration is key.
Excellent. Thank you so much. I'm going to move on to the next panelist. And this question goes to Dr. Lakay. Doctor, kindly tell us, what are the practical challenges educators and schools, or school health teams in particular, face in addressing adolescents' emotional well-being and sexual and reproductive health learning needs? Thank you so much.
Thank you very much, and this is a very appropriate question given that I have a lot of access, especially to high schools. So what I've experienced working with schools is that teachers are really groping in the dark. They don't have evidence, like where the studies that have been done, have they been disseminated to the schools? Most of the schools have no access to this. And so what the teachers are using to support their students is either their personal experiences, their personal opinions, or whatever they are learning on social media or on the radio. So because of that, the messaging that even a child in the same school gets from different teachers within the school are completely different. We've had situations where girls are being told by their teachers to, when you finish secondary school, hurry up, make sure you get married so you don't get fibroids. So what they're doing is they're telling this child that while you're in secondary school, begin looking for the man you're going to end up with. And you cannot really blame the teachers once again because they do not have the evidence. If they were to go online, where would they go to find the information that they need? What is the burden of mental health among young people in the country? Where can they get that information? What are the different types of mental health and emotional issues that are affecting young people? Like the data, where is it? And because of that, teachers are really struggling. A number of schools, especially private schools, can now afford to hire a school counselor, but many schools cannot afford it. And even when a school gets a school counselor, after some years, the children begin getting suspicious of the counselor because they see this counselor hanging out with the teachers at tea break. Now how do I go and tell them my personal things? So I think the lack of a central place, one, for information, but two, for support, is giving the teachers a really hard time in managing mental health in schools. Thank you.
Thank you so much. What is coming out from the two panelists? Centralized, centrality, coordinated efforts, working together. But we still want to hear from others and see the train of thoughts that we are developing here. So I'm going directly to Haji. Education, they say you're not working with others. Say you work alone. Health does their things. Gender is on it. So tell us what is happening in the schools. Your question is here. How can schools and communities collaborate more effectively to create, one, safe, two, supportive. Actually, I should say create, one, safe, and two, supportive environments for young people, especially adolescents, and for their mental and sexual and reproductive health. Thank you.
Thank you very much. Indeed, schools cannot work in isolation. Because when you look at adolescent health challenges, including the spike in alcohol and substance use, depression, sexual reproductive health issues, all of these ones come from the communities and they spill over into schools, thereby affecting the teaching and learning environment. So for schools to address them, as the education sector, we are aware that schools are institutions of social change within the communities, and that's why right from the composition of the governing bodies, there are different representation from the communities to ensure that all issues discussed are all embracing and everybody is doing their part. When we look at mental health of young people, for instance, the education sector, one of the opportunities may be, which would also be an avenue for collaboration, is that in Circular 20, it talks about the creation of the weekly mental health hour. And the teachers, as the first point responders, are not really experts in this. So we are trying to link schools to the nearby health facilities for collaboration, for the health facilities to support them. But we also closely working with the community development officers, because a number of issues come from communities and they spill over into schools. So creating a safe and supportive school environment really requires a multi-sectoral approach, which we are scaling up from the national level, because at national level we have really closely worked together on all of these policies up to the school level. And finally, early this year, the First Lady and Honorable Minister signed the guidelines, national guidelines for integration of mental health into schools. This document spells out the different roles of stakeholders, including parents, including the religious leaders within the communities, including the schools. So it is a bit comprehensive, and that is our role as the education sector, to ensure that we bring everybody into the limelight to discuss these issues.
Thank you. We are going to join you in that limelight and we shall follow you. I noted something you said, Haji, and I will come back at some point. Let's pray I don't forget. Thank you. I'm going to Albert. Albert, please tell us, I know you work for CRVPF that has done mountains of work in the East African region to end violence against children or prevent, and you're supporting parenting interventions all over the region. That is wonderful. But we also want to hear your views as somebody representing CRVPF on the mental health of adolescents and their sexual and reproductive health. Because whether we like it or not, these are still issues that can actually predict or contribute to the violence we are trying to fight. Examples of violence and their drivers are many, and some of them are so subtle and hidden within our social practices. The question goes, how do current national policies and frameworks, like the National Framework for Education on Health and Life Skills and other guidelines, address the mental health and sexual reproductive needs of young adolescents. What would be your views?
Thank you, Doctor. Thank you, members, for having us. In my position, I've seen the interest of governments in the region, particularly in Uganda, around the issue increasing, especially after the COVID-19 pandemic. Most governments have picked up interest and have come up with a number of policies and frameworks to support mental health. Like Haj said, for instance, in Uganda, we have 1 hour counseling session, but the reality is it being practiced? Are the teachers doing it? That's what we think we need to ask ourselves. Whereas in the policy it is stated there, do we have the manpower to do that? So that's one of the challenges we see. And then the other thing is around, for instance, in Uganda, in the policy framework, they gave the percentage funding. I think it is 1% for the institutions that they get the money to support mental health challenges in schools. But then also the question that we ask ourselves as practitioners is that, to what extent is that money getting to the schools? Is it getting there in time? Are the schools committing to it, or it is diverted to do other things? The other thing also in terms of support from the framework is around the training of teachers. I know like in Uganda there is a handbook for teachers' handbook for mental health and psychosocial support. To what extent are the teachers being trained? Put in consideration that these teachers themselves come from home with their own pressures. Ose has just been telling us how the parenting is a challenge. So we understand that in the policy framework, there is training and building capacity of teachers, but the reality, what is the reality on the ground? The teachers do not have the skills, they have their own pressures. A number of teachers, you talk to them, they have loans from different institutions and banks, and then what happens? They transfer that to the children, and the children only experience the violence. For me, the other area is also that the policy frameworks we have in the region talks of private partnerships, public partnerships, and have created an environment for NGOs like us to come and support the environment, which is a good thing. But then I think for me the challenge is what everyone is raising. To what extent are these institutions coordinated? You'll find one under Ministry of Gender, there's others under Ministry of Education. To what extent are we coordinated? We know that, for instance, Raising Voice came up with a good school, a good evidence-based policy, the Good School Toolkit. But we have others who have other manuals that are used in schools. Like she said, so one teacher comes from this school with this message, another teacher comes from this school, and then we end up confusing the children. Remember, this is at the stage when they are developing their perspective. But we have several messages that are coming through. So how do we make sure that these messages, these manuals that are coming through are well coordinated and structured? The other thing is for me that I think which is a great opportunity is the revision of the competence-based curriculum, because you realize that some of the things that were originating a challenge for the students was the pressure to do exams, the pressure to pass the content and move to another class. I think the introduction of competence-based curriculum was a good thing. But to what extent are we prepared? To what extent are the teachers on the ground adapting to that? So that then we are able to translate that and remove the pressure from the children. I will tell you up to now, I see here vans around 4 a.m. collecting children. So if our curriculum was to reduce that pressure, why are we still collecting the children at 4 a.m.? So I think we have the good policy frameworks in words, but in reality on the ground, what is the practice? The other thing I observe for me is the multi-sector coordination. I think the government and across the region, we talk of multi-sector coordination, but what extent, what level are we coordinated? You fear the ministries for me seem to be competing. Even when we talk of the East African community, we still think we are competing against each other. So what is the reality of multi-sector coordination mechanisms so that we are speaking one language? You'll find one policy in the Ministry of Health. There is another policy in the Ministry of Gender, almost the same related topic. So where do we bring it together? Yet the governments are our central, our anchoring point. So for me, then the policy framework say we need to work in multi-sector, but then what is the reality that we are doing? For me, the other thing I think we also need to reflect on is our policies, I think, currently are focusing on prevention as a key, which is good for me. But then how much have been intentional to prevent and stop mental health challenges, so that then we are able to live in the reality. Because we may talk of prevention, but when in actual sense all of us are still stuck in responding in child protection. And I think when we do it earlier and prevent, that will help us to have the reality on ground. Thank you, Doctor.
Excellent. Thank you, Albert. You mentioned a lot of things, and one of the key issues you highlighted is teacher training and a mismatch between what the teacher carries into their profession and what they find on the ground. One of the things I want us to reflect on as well, based on your presentation, is the workload the teacher has. Timetable overload. Haji pointed out to extra ring, can I use the word, this mental health response. Let's return to that later. So Hosea, parenting, indeed, we are because our parents did. Someone once told me, teachers teach the way they were trained. You're trained well, you'll teach well. You're trained like that, you'll also teach that way. So, are we a reflection of the parenting we got? The dot-com parents, we are never at home. The mothers are not there, the fathers are not there, you know, the maids have taken our roles. We are filling that vacuum with gifts, truckloads of pocket money, international trips, elevating our children to levels beyond what reality offers. Then when they come, they just crash. How does that help their mental health? Hosea, here we go. How can communities and parents be meaningfully engaged to promote positive norms and behaviors around mental health, resilience, and sexual and reproductive health among adolescents? And what approaches have proven to be most effective? Thank you.
Thank you so much, Dr. Betty. Before I go to my question, I would like to strategy or people who are saying who is leading, who is the ladies and gentlemen, whoever feels the need can come up and say, I'm going to lead this. For parenting, for respectability to be now recognized by WHO and the government of Uganda as one of the 2 evidence-based parenting programs, the drumming had to be louder than even policy. One organization can come up and say, I'm going to lead this. CHDC did their best to bring parenting to the table of policymakers, to the table of local governments, and the issue of evidence-based, before I joined CHDC, I'm told by the founders that in the corridors of Ministry of Gender, they were no longer being called by their names. They say, oh, Madam Evidence has come. Oh, Dr. Evidence-based has come. Until they were heard. And now we are at the table negotiating how do we move forward, scaling. So if we see this as a critical issue, one of us in this room has to come up and take the lead. Define what you want the country, which direction you want to take, craft it well, advocate for it, make friends with policymakers, be available in all spaces, and sell the need for sexual reproductive health to be a multi-sectoral aspect. Things will be there. Because right now, with parenting, at least the direction is very clear from national level up to the local level. Let me get back to my question. Sorry to diverge. How can parents, first and foremost, as I say in our presentation, that the family is the core. Co-designing of interventions or programs is very important. Think about the end user when you are starting to design the intervention. Make them partners, make them own this aspect. We have an issue. I happened to work at some point with Minister of Education and the RTI and other things. We had an issue defining sexuality and sex. Even the teachers themselves still define sexuality as sex, but sexuality and reproductive health goes beyond sex. So when you are explaining this to the teachers and the parents, you need to co-design with them to define what this is and what does it benefit the learners. Because before you go, for them, they say, oh, bagenda kusomesa bana baffe bya busiru. Actually, some people still think sex bya busiru, isn't it? But sexuality is beyond that. So we need to co-design with them where we are going, how much we need to involve them from inception so that they know why this program is coming. What are the benefits? What's the problem we are trying to sort out? That would be my starting point. Work with the parents from the word go, even when they seem not to understand. We talked about a formative evaluation. It's just looking at acceptability, relevance. Do we have a group of parents that see this as valuable? Can they become advocates for future intervention? Number 2, dialogue. We call it intergenerational dialogue. We are in a situation where parents and adults are seen as the fountains of knowledge, and they want to pass their knowledge to the young ones, but the young ones have the experience they are going through. How much have we listened to them to see their world? My son happens to go to one of the schools that gives that liberty of some free time, and he comes back and says, Daddy, school is bad. I say, why? Can you imagine the teachers took our time for this? We're supposed to do this. How many schools offer children chance to speak about how they feel? Because social emotional learning is about how do I feel today? How does it support me to take decisions that will inform my future? If we don't cultivate an environment and support the schools and the parents to offer room for dialogue. Wake up, go to school, but as your child is pulling a long face in the car, can you ask, can we teach this parent to say, hey, Mark Samuels, what's the dog face about? He could tell you something and say, okay, now we are going to talk to the teacher. So we need parental skills, really, to know that children are not robots of do, don't, but they are human beings who have feelings, who want to express their feelings. The other aspect I want to say is advocacy for negative social norm change. Not all social norms are bad, but there are those ones that we need to advocate for eradication actually from our country. Girls don't talk. Now, if you have not allowed the child to talk, how is she going to talk about this other guy who is harassing her? You get it? you gave us the honors to share some live examples. My daughter was in senior 2, and this young man wrote a very nice letter to her. She said, "You wait, my daddy comes." And when I came, she said, this young man who wrote this to me. I did not beat her because a man has talked to her. We had a dialogue. What does she have to do next? If all parents had these skills of telling, hey, I think you are getting to 10. These days, girls experience 1, 2, 3 when they are growing up. Hey, I can, my nose brings something to me. Parents, once we equip parents with that, the girls and the boys will be able to express themselves and will be able to tell us how they feel. That will be a way of taking care of their mental health. Because mental health is about, how do I feel today? Do I look at my dreams, or my dreams are shattered? Last term, the school where my son goes has both a national and international. So he had boys they were chatting with who are friends in the international, who transferred to another international school to do their Cambridge exams. So I come back. The guy is as tough as anything, and then he broke down and said, "Max, why are you crying?" "My friends have transferred." Another parent said, "Don't tell me about your friends. Are they the ones?" But if parents are given skills of handling such situations, just reading your child, I think that will be okay. Then the male caregiver involvement and engagement. Carol has talked about it. And gentlemen here, let us go beyond being an ATM, cash machine, provision. If your daughter or your son comes to you only when there is a need for something physical, then you say, "Sazi wa de mama wama, didn't I give the money to your mom?" You are fighting a losing battle, ladies and gentlemen. You parents, we can empower parents to know that we need a conversation, however useless to you, it may seem is quite meaningful to this child. I learned to watch this Indian certain kado, because my daughters and my sons would sit and say, "What are you watching?" Now they start telling you how good this man is. So I would spend time, male caregivers, spending time with their children. We need to wake men up to take up this role, to go beyond just provision, as people are saying. When we age, the children come and talk more with the mother. They leave a lot of money. They give me 10K, and I start complaining. So these are the analogies we need to take down. The issue of teachers is key, because the teacher is the second parent, isn't it? Out of the 12 months, I'm with my children 3 months. How much have we handled the teachers to handle their baggage to be able to handle our children? When these young girls' bums are rounding and whatever, this male teacher who has come from university for his school practice, is he aware that this girl has dreams? Is he aware that you're not supposed to touch her bums? Is he aware that the way you say you are beautiful has to be controlled? These are some of the simple things to me that make more sense to parents, communities, and duty bearers that are handling our school and community partnerships. I know this program is going to schools, the 10 schools. Let it be a school community, not a school. A school community involves the physical school, involves the community around that school, where the children come from, and the home. There should be a clear communication channel. Today, Jane has not appeared to school. May I know what is happening? The parents say, "I sent." Is the LC1 or the PTA chairperson know that he's supposed to scout around to see whether Jane actually reaches school or not? And lastly, ladies and gentlemen, because of time, what we can do let us build evidence of what is working and what is not working. Much as the policies are good, we need to show the policy makers what they can support and scale. As I will tell you now, if Betty went to Mr. Chibeng, PS, Minister of Gender, and say we have a parenting program, say that one I must attend, because there is evidence. Let us build the evidence. Whatever we do, let us document and then disseminate, because there is evidence in our cabins and our computers. How much have we gone back to the people where we collected this evidence and disseminated to them and say, people of Wachiso, 50 men participated in this program and we see this change. Thank you so much. Can we have others join? So that is my last. With all that collaboration, partnerships, and government as our key partner. Because the people will determine where we go and where we don't go. Let us collaborate. Even when you say you are in Ministry of Health, you can still collaborate with someone in Ministry of Education, Ministry of Gender, and anywhere else. Thank you so much.
Good. Excellent. I said we clap like we mean it, like this. Nursery school style. Okay. This is Madam Evidence. Now her name changed. She's talking about Madam Evidence. They understand what we are doing. We are going to clap, but we still have questions, because I want us to clap deliberately. Okay? With energy. We have breakfast, okay? 1, 2, 3. Yongeza tena. Wonderful. We have heard everything about parenting. We heard about teachers. We heard about policies, collaboration, all sorts. The one thing that has come out from the panel is that wherever we work, wherever we are, we have not gotten into systemic thinking. We look at life and work as me, my, and my expertise. We forget that the world is interdependent, interconnected, and because of that we interrelate. The adolescents we are talking about are not living in a vacuum. They live in our homes. When you talk with the heads of the schools where your children go, trust me, they will reveal a lot of problems. Sometimes you find parents fighting on the phone, abusing each other, because one parent has blocked the other from seeing the child. Those of us who are parenting teenagers, there is a time when this teenager withdraws. You know, as they grow, there's a silence they get into. Let's learn to read the silence. What is the silence communicating to us? At one point, my daughter, I was in the living room, she was in her room. Many years ago, she was in primary. I see a message pop on my phone. I opened the message, I think it's from someone. Someone in the bedroom has sent me a message. And I'm like, okay, what is this? Mommy, you don't want to support my dreams. And I'm like, you come. Which dreams? Let's go and we talk. What dreams haven't I supported? I've told you I'm interested in fashion, I want to do pageantry, I want to do ABC. Hey, only that? Please. So long as we agree, do what you want. I give whoever is training you my conditions. No makeup, no swimsuit pictures, and you get me? And also, your grades don't fall. Can we agree to that? We have been navigating that route, and it has been working. Because if I came to think like the Acholi mother, like he knows, they say girls don't talk. For us, we talk. We even talk more than the men. Hey, we talk. Because if I had won that heart, hey, I don't know what language would have been spoken in that house and where that child would be. There are times when we have to compromise, meet the child at their level, then you build from there, especially with adolescents. Come to their level, understand what is bothering them. The conversation begins from that, and allow them to take a lead in the conversation, not only drumming your ideas all the time. In the Parenting for Respectability program, we have another program. Actually, we wrote a manual for the government, the National Parenting Manual. We created a specific activity on parenting. There's, Hosea, correct me if I'm wrong, there's parenting adolescents and parenting young adults. The ones who are out of university, they still have the adolescent mindset, oh. They are still there. They are still living in your house. You're going to have to work with them as well. That should be a deliberate effort by all parents to pay attention to what the child does not say. It's very important. Now I'm going to give each one of us 2 minutes to respond to some of these questions. I'm coming back to Olga. What does current evidence tell us about the link between adolescents' mental health and sexual and reproductive outcomes? Just very briefly.
It shows that there is a strong correlation.
Speak up,
Evidence shows that there is evidence to show that there is a strong correlation between adolescent mental health and sexual and reproductive health rights or sexual health. If we look at a 15-year-old getting, I gave birth to my first child when I was 33. I was overwhelmed. Now I can imagine a 15-year-old. I imagine not just their body, but their mental health. So if we don't guide young people early enough, then they will be prone to this. Young people should know how to not just take care of themselves, but to make decisions around their sexuality, to create boundaries. And these are things that are also taught in a mental health class, in a typical or rather basic mental health session. Poor mental health really leads to poor choices in terms of sexual reproductive health, but also sexual reproductive issues also affect mental health. So I would say that, but also to add that the age group we are looking at, about 13 to 19, is a critical one. Many young people have their first sexual experience in that age. University is where many people, and I don't know what current literature says, but I know there's literature in that line. So we need people to know, we need young people to increasingly know about these things, but also while considering the cultural appropriateness of this topic. Say that between 13 and 24 is where many of us, our mental health as young people, but also as adults, is determined between that age group. So there is every reason for us to not just drum, but drum meaningfully. Because if we don't, you will say you're taking care of your child, you're doing this for your child, but your child is in the same school, the same community with this child who is not being empowered, whose mental health has been compromised. Thank you very much.
Excellent. Thank you, Olga. I'm coming to Haji. Schools. Schools are implicated in everything. That's where all the pressures come from. That's where all the behavioral issues arise, management of issues, teachers almost stepping into parenting roles, yet they really are not parenting. They have a lot of their own workload. Then you earlier mentioned that as a ministry, correct me if I'm wrong, we are considering, not so? Either integrating or bringing this mental health, adolescents' mental health issues or management or resilience into our education system. How exactly are we doing this? Because I heard you use the word extra. That means we are considering this as an extracurricular thing. And if we treat it as extracurricular, are we giving it the prominence it deserves? Is it really going to work? Thank you.
Thank you very much for that feedback. I would like to inform this gathering that really a lot is being done at the education sector, including the standardization of the curriculum on mental health and sexual support. And we are telling all the DEOs, whoever is working in schools, to use that, because we want to avert the situation where we are saying different partners come with different materials. We have developed a lot of other supportive materials. But also, you agree with me that if we are to make meaningful impact on young people's mental well-being and resilience, then investing in really running institutions is the right decision. Because this is where they spend much of the time, but also we do a lot of preventive rather than responding to issues when they have really emerged. When we look at really the education sector, recognizing the impact of emotional well-being on the teaching and learning outcomes, that's why the government of Uganda has started facilitating capacity building of teachers. For the last 2 years, we have trained teachers in the Busoga sub-region, Buganda, Nkole sub-region, and Acholi, which is really a positive development. This is purely government of Uganda from the Consolidated Fund. Teachers' resources have been developed, but also we are trying to strengthen peer-to-peer support, especially through the clubs. If we strengthen these forums where young people can share experiences and support each other, I think we'll be a long way in enhancing their emotional resilience and consequently be able to do well. In terms of also collaboration, Ministry of Education has offered leadership. It has been the Secretariat in coordinating efforts around the education for health and life skills. Because rather than duplicating, as one of my colleagues put it, we are saying this is one government, so we need to have one policy, and exactly this is what we have done, and the mental well-being has clearly come out, and finally we have developed, we are working with Unity to ensure that we have a module for pre-service and in-service teachers on mental well-being and sexual support. Thank you very much.
Wonderful, thank you. Let's keep it to under 2 minutes or 2 minutes. Okay. Dr. Lake, could you tell us, given that most tools and interventions that we use for adolescents' well-being are from non-African contexts, how can we contextualize these and validate them to fit our context so that they are actually fit for purpose? Thank you.
Thank you very much. That's a really important question, and I look at it from 2 angles. These days, we say a lot of the things that are being implemented here are from a different context. But if you think about many of, especially the urban young people, their experience is actually the urban experience, because is the Western world experience, because they are learning through the internet. The way they are dressing up, the way they are talking. My children sometimes call my husband and I bro, right? That is not from Acholi, that is from America or wherever. So as we are thinking of contextualizing these instruments for our country, let's remember that it's really important. There is a category of young people who are still rural and are still very much influenced by the culture of their traditions. But many of the urban ones, look at us even as parents here. Many of us do not even know our own cultures. Many are intermarried, and many of us are learning how to parent online from things that are being done in Europe, Australia, America. So when we think about contextualizing, let's not think about what Uganda looked like, what the Baganda, the Basoga, the Luos were like in 1962. Let's think about what is our current context and make sure we are developing these to fit the context. many of us still have the thing of telling children, don't speak when adults are speaking. Which culture is that now in this day and age? So as we are developing these interventions, let's remember that culture is not static. Culture changes. I grew up in the 80s and 90s. That culture then is not the culture I should be expecting my children to wholly adopt. Thank you.
Thank you so much. Remember, culture is not static. Culture is dynamic. It is changed with the insights of our times. In our times, we have the internet. We have all sorts of things that is influencing how we live and what we do. I'm coming to Hosea, and let's keep it again short. I'm glad that you're coming after Doctor's comment of culture and not being rooted. We are not grounded in tradition as much as our parents were now. How are we addressing the social norms and practices that affect adolescents' mental health and sexual and reproductive health? You mentioned sexuality and sex education. And a lot of what we call negative sex education come from our cultures and their practices. We have examples of female genital mutilation in some parts of the country. In Buganda here, we also have practices that are endemic. They are in society, but they also transcend to the school boundaries. We all know. Do I have to say it? Should I say it? Going to the bush. Yes, going to the bush happens at home, but the ideas are carried into the schools as well. So in the schools, are there bushes? So how are they doing the bush thing, and how can we root that out? How can it, question. Thank you.
I wish I had a different question.
Sorry.
Thank you, Betty, but social norm change can't happen overnight. It's a process, but it starts with engagement, how you engage with custodians of culture to see the value of what you are advocating for. If you go with the evil first, not the value, the custodians are going to resist. So advocacy should start with those custodians. We have the cultural institutions. How much are we engaging them on issues that are affecting the adolescents? We have our religious leaders. How much are we bringing them on board? And when we are engaging with our parents, we start from the known to the unknown. There are those people that are entrenched in those practices because they don't know the other side of the river. It's you who comes and says, hey, this is good, but something better for the mental health of your child is this. Because if you impose it, when I was young, I hated one culture that wrapped an old man, and they ganged against him because he had refused to do a practice and ran to Luero from Bale. But they wrapped, so I started fearing, wasn't there any other way? So I would say dialogue positively with the custodians of culture and bring them on board into this programming would be better.
Thank you so much. So as we co-create, as we develop curricula, as we develop programs, how many of us have engaged the different cultures and the voices, the said custodians of those cultures? Because if we don't, then we are still going back to the silos. This is the element of co-creation, and that is how it's going to work. Now, Albert, the parting shot from you. What life skills do adolescents need in the 21st century to survive with resilience? Thank you.
I think for me, it's about making decisions, because we live in a world that is rushing, has a lot of competition and communication, and a lot of things coming with a lot of pressure. We can have skills that making decisions and choices, for me that would be the greatest thing that we can give to the adolescent girls. Thank you.
So, once again, to our esteemed panelists, can we give them a 3 factorial, a proper clap, and we show we appreciate them. Thank you so much. You have not followed. You want me to fail? Say, please, okay. Asante sana. Nyongeza tena. Thank you. Thank you so much.
Thank you so much, Dr. Betty Okot and the team of panelists for sharing your insights on what it really takes to align education, health, and policy systems for mental health and social reproductive health and rights. I know we are burning with questions, but with the constraint of time, I would like us to understand what exactly is resilience and social emotional learning, the program that we are going to implement in partnership with all of you seated here today, and some of us who are also following online, and some of us who wished to be here but are engaged. And I know online we are joined by our partner from WHO Geneva in Switzerland. Bastien Sherry is online. Thank you so much, Sherry, for joining us and listening to this conversation. And now it is my pleasure to welcome our Executive Director, JM Education and Research Center, Dr. Mitana, to share with us what the roadmap of the Rsel program looks like and what are the next steps from here. Thank you very much. Dr. Mitana, karibu.
Thank you so much, Sheila. And thank you very much, our esteemed panelists. You have actually eased my work. So I won't labor so much explaining a lot of things. As the presentation is coming on, I wanted to explain a few things about this program so that we don't waste any minute. Why, first of all, we are choosing to take an intersectoral approach and not one-way approach as we have always done. As GEMAC, when we are founded, we have been working with the Ministry of Education for a long time. And we thought that the problems we were solving were solely educational. But to our surprise, we have discovered that the challenges we are trying to tackle with the young adolescents, they are gender related, they are health related, they are culturally related. And that is the reason why we said, hold on a moment. We need to engage all of these people from all these corners to ensure we are talking to the challenges that are facing the young adolescents. I don't know, can we go back to our slide? Okay, second slide. So as GEMAC, as Sheila already said earlier, we have been existing solely to ensure that every child and youth is able to learn achieve and thrive. Again, basing on our vision, we believe that children are not there only to learn. They need to achieve as well, because it is different going to school. It's another story achieving what took you there to school. But again, when you limit it to achievement alone, we miss the point. The children need to thrive after school, while they're in school, but also after school. I was in school. You were in school. Are you still there? Aren't you thriving? And that's why we don't want to limit our agenda on learning achievements. They are good, yes. But so what? You get your first grade. You get your 10 A's, whatever they are called these days. So what? And for this reason, we work to strengthen the school ecosystems so that they are able to support this agenda. And I call it agenda, not just a vision, but an agenda. Can we go to the second slide? And why the Rsel program, my dear friends? You may notice that from literature, every year about 21 million girls aged between 15 and 19 get pregnant every year. Some could be our relatives, maybe. Some could be our children. And we also know that from literature that about 120 million girls under 20 years of age have experienced sexual violence in one way or the other. And we have discovered some great opportunity from literature again. Evidence indicates that schools and communities can give us opportunities to change this, what we are calling a crisis, into something positive, into something better. And again, the ages 10 to 14, they are sometimes termed as windows of opportunity if we are going to groom the younger people. Because this is the period where the children are forming their identity. It is the period where children are beginning to ask themselves, but who am I? At 10 years of age, that's when the girl child is beginning to understand that she's a girl, or I'm a boy. Before that, they know they are human beings. But this time they begin realizing totally that actually I am a girl, I'm a boy. And it is this critical moment that if we are to cause any permanent change, if we are going to influence their formation, their identity formation, this is the critical age. This is an opportunity window that we cannot afford to miss. Remember, in my language we say, bend the tree when it is still young. When it is old, it will break. And that's why we are focusing, this program focuses on ages 10 to 14. And schools, again, are a great opportunity. Some of us who have children in boarding, children take about over 80% of their time at school, and less than 10% with you as a parent. And that means that if schools are not doing the right job, if teachers are not helped, if they are not supported to support our children, then we shall miss the point. And that's why we cannot talk about young adolescents without talking about schools, without talking about teachers, without talking about the school leaders. We can go to the second slide. Again, we have some interesting statistics here. Globally, 14% of adolescents are grappling with mental health challenges. About 14%. That's a big number. And again, another statistics is telling us from the World Health Organization that 50% of mental health issues begin at the age before 14. That is half of all the challenges of mental health. They begin before age 14. And that means if we are going to make any meaningful intervention, then we must target this age bracket. Don't wait for people to reach my age and then you say you are going to improve their mental health. Never. I'm not saying I'm unchangeable. Don't fear me. But the issue is the rate at which I respond to your intervention is slower than this other child who is still in the formative age. In Uganda, again, statistics are showing us that 22.9% of the children we are talking about in this age bracket, they have mental health issues. And that's why the commissioner in the morning was mentioning, but even Betty Murondo mentioned it in the morning, the rate at which our children are hanging themselves, they are killing themselves, and many other indicators that we are seeing in our families, in our communities. And I think most of them are not reported. And it gives us the reason to say, if we didn't act today, then we are late. We should have acted yesterday. Even today, we are late. And if we don't act, there is a likelihood that we are going to have many increased challenges of early pregnancy. You listened to Dr. Olga very well when she was mentioning the intersection or the relationship between mental health and sexual reproductive health. The two are interrelated. They are inseparable. And yet most of our programming, as we shall see, is always done as if it is like you go to a hotel, like we are going for lunch, they first give you salt. You first lick some salt. Then we shall give you food. Then after finishing the salt, they say, okay, we are bringing now matoke. Then afterwards, they say, you first rest. We shall give you some water. So the water is going to make some soup. So at the end of the day, they tell you that, salt, then water, then matoke, then some meat. You ought to have a balanced diet. We need to make a meal, tell me. And that's why sometimes we go to schools, we have programs, they are good, yes. We go and make some good noise about sexual reproductive health. And we don't mention about anything about mental health issues. We keep quiet, we go back. Another one will go and talk about mental health. Another one will talk about other things. We are saying it's high time. We put all of these things in a good ruombo together, and then we serve it to the people that are supposed to have it. And that's why maybe it would have a meaning for them. Instead of saying it is ruombo, but I will first give you onions. You chew onions, and when you are satisfied, you go. You come back tomorrow, and then I will give you salt. No. That will not make a good ruombo. Anyway, I don't know how to cook, but that's what I can tell you. But also, there is likely to be high level of unprotected sex or unguided sexual relationships, which again are going to worsen mental health. Again, are going to lead to an early pregnancy and many other things. And then the consequence is going to be the high school dropout rates, and many other things are going to come as a result of that. Can we move to, okay, thank you. So here we are saying there is a critical gap, an opportunity with the younger adolescents. And when we talk about young adolescents, we are more focused on young adolescent girls. But also we are aware that girls don't live in isolation, they live with boys. So much as we are focused on young adolescent girls, but also we want also the boys to know what they're supposed to know, and to live and grow as responsible gentlemen, not wolves. So here we are saying that ages 10 to 14 are critical for developing identity. It's a time they're discovering who they are and emotional regulation and healthy behaviors. And so we need to tap this age bracket before it is too late. Yet we also see that most of our programs are targeting the older adolescents between 15 onwards, because they think these are late adolescents, so they are in a danger zone. We focus on those. And yet, probably, we could have avoided much a bigger problem if we had targeted them maybe at a younger age. And this gives us the rationale, the reason why we are saying, hold on, we need the young adolescent girls first before we go to, after all, if we focus on the young adolescents, tomorrow they will be the old adolescents. But if we focus on the old adolescents, they will never be the young adolescents. It can never be. It's like you're now focusing on us here. We shall never go back to be young adolescents. But if we focus on young adolescents, at one point, they will be like us, and better than us, probably. And again, the statistics are showing us that in Uganda, 1 out of 3, that is a third, gives birth before the age of 18. And 1 in 4 gives birth before the age of 19. Are those statistics not worrying us? When we talk about these age brackets, say 1 out of 3, you may not see what it means unless you see one that you know is in this bracket. That's when it touches your heart and say, hey, the problem is there. See, sometimes as Ugandans, even as human beings, when there is a problem in Guru, those in Mbarara will say, oh, I think Guru is very far. When it is in Kanungu, they say, let the Kanungu people sort it out. Even the one of Rukunji will not mind. Until they see the problem is shifting from the Nengo to Rukunji, and say, hey, hold on, we need to respond. Remember, there is no one that is safe in a sinking boat. No one is safe. Even when the percentage is low, we need to act. We can proceed to the second slide. Again, this is what I mentioned earlier, and I won't take much here. Again, this is another opportunity to ensure we focus on building younger children's resilience. Why resilience? We can no longer protect the children physically. You are with your child, but the child is in the UK through social media. He's interacting with the people who are somewhere. I liked what Dr. Rake has said. Even when we talk about contextualization, we need to understand what are we contextualizing? What is our context today? So what we need is to ensure these children have the resilience to stand against the odds, to discover who they are and live a meaningful life. The millennial lectures of don't, it won't work today. The children have to build and grow their own resilience. And again, emotional skills. Why many children, adolescents and youth, even most of them are committing suicide? It's because probably their emotional skills, they are not able to cope with the challenges that are affecting them. Even us sometimes, we break down. How about these young ones? And then, above all, to help them to make healthy decisions. Even if you are as tough as, as Goliath, you'll never be there with your son, with your daughter, when he or she is crossing the tax park. Somebody was saying, I think that was, I don't remember what that was, Hosea, who was saying, teachers should not be touching the bums of the girls. I don't know who said it. But you as a parent, you not be there to see who is touching and who is not touching. And who is saying you are beautiful and who is saying you are ugly. And that's the reason we need to teach them to make their own decisions. Not our decision, but their own decisions, backed by resilience. The rest we talked about them. I don't want to repeat them. Let's go on to the second slide. And so how does our research program work, or how will it work? The research program will have these interventions. One is teacher-led. We shall be using a teacher-led approach, where we shall work with the teachers, train them to give the intervention to the children they teach, because they know them better. And they stay with them longer than any one of us. And then that will lead to the school-based mentorship through the menstrual and healthy and mental health clubs that will be based at school, again supervised by the teachers. And then we shall have teacher training, because teachers are the pillars of whatever happens in the school, and the school leaders as well. And then parents and community engagement. And that is why in the morning we had a lengthy presentation on parenting. Because much as we are saying that we need to have good, positive school environment, but again, these children don't come from trees. They come from families. And these families and parents and the communities need to do their part. Then, in terms of the skills and knowledge, we hope that when we do this, then we shall lead to improved sexual reproductive knowledge and responsibility. We are focusing more on responsibility. Many times we have focused on rights without ignoring the word responsibility. We think children should have only the rights, but they have also the responsibility for their lives. It is their life after all, not our life. So they take responsibility for that as well. And then we also need to see that there is improved communication and social skills. We want to see that they have strong self-awareness among themselves, but also that there is improved self-efficacy and self-concept, knowing who they are. So that, sometimes, because at this age they are changing, sometimes they are not fully aware of who they are, and so the changes they are going through at times affect them. Can we move to the second slide so that I move to this? Here, this is where I want to us to pay attention, and this is the more reason why we invited you. This has been co-created as a 3-year program. In this year, the first year of 2026, we want to adapt the program. And I will explain more in the second slide. Then in the second and third year, which is 2027-2028, we shall pilot the program in 20 schools within the districts of Luka and Wujiri districts. And then, towards the end of the year 2028, we shall have the results, the evidence, to tell us, together with you, when I say us, it is you inclusive, I will say why you are included as well, to tell us whether we need to scale it and where and how. Let's go to the second slide, please. So these are the activities of this year, and this is where I need your help. In this year, the first thing we are doing is program establishment and governance, where we shall look at who will be part of this intervention, which ministries, which people, If there are other people, other organizations that want to be on board, who are they and what are they bringing on board? And that's why we are talking about technical and advisory groups. There are two groups that will be formed, and most of you will be part of these groups. The technical will be to guide the development and contextualization of the measurement tools, but also the materials, so that they are culturally adapted, culturally relevant, and they are speaking to the needs of the young adolescents and of the communities from which they come from. But also the advisory board, group rather, is to ensure that whatever we are going to be putting across responds to the policy and structural needs of our country, Uganda. For example, how does the program respond to the current framework for health and education on life skills? Then we shall have stakeholder engagement through those groups I have mentioned, through consultations. After here, what we are going to do is a formative study to come back to you to get more informed views, but also from parents, from these young adolescents. What are the peculiar challenges that they are facing, and how can we better respond to them? And this study is going to lead the development of the materials guided by the framework that the ministries, the three ministries have put up. And that will also influence again our theory of change, to refine the theory of change in the course of the year. And then in this also we shall streamline the formalities, the working formalities with the three ministries: the Ministry of Education, the Ministry of Health, and the Ministry of Gender. Well aware that these children and this program is responding to the framework that the three ministries have put up. And we don't want to go offline. We want to ensure we are complementing what is already in place. We're not creating something new. And in this year still, we shall ensure that we develop all the toolkits. So we shall have a series of validation and validation to ensure that every letter speaks to the needs of adolescents, but also speaks to the realities of our country as Uganda. And besides the toolkits, we also have the measurement tools. Also to see that at least we are measuring what we need to measure, and we're able to get the results that we intended to do. And then the second bit is evaluation framework and tool validation. Again, after developing the toolkits and the materials, we shall validate the tools and also ensure that our evaluation framework speaks to our theory of change, so whatever I was talking about before could be completed there. And then lastly, to have the partnerships formed. Who will be part of this team? It is not one organization thing. When we are discussing with the World Health Organization, our intention is to ensure that we are forming a network that is talking about resilience and social emotional learning of young adolescents in Uganda, and not just one organization saying this is what we are doing, but all of us are having the same conversation. Yesterday, the technical person for the World Health Organization was asking me, now that we are representing health, is UNESCO on board? And I said, okay, let's see how we get UNESCO on board, and who is going to bring them on board. Maybe all of us. Next slide. So, collaboration and partnerships here, this is what we request you. And maybe you could fall on any of those. The first one is technical and research support. I'm glad that we have here doctors and professors and people with lived experience. So we may need, if you are willing, we may need your support there. And before you leave, you need to tell us where you feel, whether you can be part of this team to come and make noise about the young adolescents. Again, the policy issues. That's why I mentioned the other 3 ministries. They are very key. And even on the research team, so far there are 3 people, and there is one co-investigator, co-principal investigator, that is in charge of policy adoption. And she was here in the morning. That is Dr. Annette Mujisha, who is actually the commissioner for teacher education. She's the co-PI in charge of policy issues on this program. And Dr. Betty is in charge of parental engagement. That's why she was talking about parents so much. And then, in case you are here and you can raise some funds, some resources, or you can connect us to some resources, we are still in need of some dollars there, or Ugandan shillings. So see where you can belong. And then lastly, sustainability and scaling. How do we ensure that this program does not stop here, but reaches even maybe other countries, other districts, other villages? And all of this, we need to do it this year so that we have a strategy that we shall develop together, knowing that that will be our roadmap as a collective. Not the roadmap of GMAC, but the roadmap of each one of us that is here. That is my call to you. And with that, with those many words, I beg to stop here so that you can raise as many questions as you can. Thank you so much. Back to you, Sheila.
Thank you very much, Dr. Metana. You can tell from how he's spoken about the program that he's very passionate and looking forward to how implementation will happen at the end of the day, being the principal investigator with support from Dr. Annette and Dr. Betty Okot as the co-principal investigators in running the Rsel program. We have had quite a number of sessions and presentations. We had from Mr. Kasule Medi, who was representing Dr. Cleophas Mugenyi. We had from Caroline and Hosea from the Child Health and Development Center at Makerere University. We had a great panel discussion. And then you have just heard about the Rsel program roadmap. I know we definitely have some questions, some inputs that you would want to share with us, or some clarifications that you would need to know how you will plug in as a partner in the program. And this is the moment for you to raise those questions, share your input, and any other aspects that will support the intervention as we move forward from this day. Welcome. The questions can come in. Do you want me to teach you the song that Dr. Betty was struggling with? She was really trying to speak Swahili. And this is my call to all Ugandans. You will sing the East African anthem alone today without my support. And I will want to hear it word for word. So I welcome questions. Daniel, please pass me the microphone. I see at the far end in the room, there's a hand, and there's also a hand on this side. And our esteemed panelists and moderators and speakers of the various sessions, please take note if a question is directed to you so that you will be able to respond. Thank you.
Thank you, moderator. My question goes to the research team. I want to thank you for the great work, and I think I should testify because I participated in your session in Bogota and you did a good work. So my name is Christine Muhumuza from Makerere University School of Public Health, and actually my research work was around adolescent girls and young women health. That's where my interest is. So I had 3 questions, but along the way, 2 have been answered, so I'm going to ask one to the research team. So based on your findings, I just wanted to hear like concrete policy recommendations that you have, that you would make, you know, integrating parenting-focused adolescent resilience interventions into Uganda's health, education, and other sectors. Should I repeat the question? Is the question clear? Okay. So I put down here several questions, but this one, I wanted to hear from your findings, like concrete policy recommendation that you have from your finding on how to integrate parenting-focused resilience interventions into the different sectors, and specifically health, education, and probably child protection initiatives. Thank you.
Thank you so much, Madam Christine. Integration of parental engagement in the programming and frameworks that are touching on parents. This is a question to Mr. Hosea Katende and Ms. Caroline Namutebi. I hope you have taken note. Let's get 2 more questions and then we can get feedback from those concerned. Yes?
Okay, thank you, colleagues, and the research team. We appreciate you for the job well done. However, in your presentation, if we could seek still guidance from you, if we could see one of the best practices, maybe, that influenced or that impact, because in a very, very short while, it shows that we had significant change. But with the team inside here, maybe if we could have some best practices that we can benchmark on. Thank you. I had quite many, but since that is it. Thank you.
Thank you. Best practices from what we have had. I think all the questions are directed to the research team, and I think it is great that we are understanding parental responsibility is really a cross-cutting issue. So let's, Daniel, just at the front here. Oh, there's some, okay, thank you.
Thank you very much. Mine still goes to the research team. They say the presentation was very beautiful, and but I was concerned about the randomized control trials. I'm Henry Nsubuga from Makerere University Counseling and Guidance Center. Randomized control trials, and knowing how randomized controls are difficult, I wanted to ask you more. How did you manage to get such a good reception? Because it seems to me you even had a very high retention, and yet and I wanted to shed for me a picture of how exactly you managed to handle this, because given that it's a community, how do you get people to come back and do all that kind of stuff? It's a great practice that many people need to adopt, especially given the nature of study. And I would still be very interested in picking it from Mr. Mitana's presentation. I have been part of a consortium of about 27 people from, 27 countries studying socio-emotional learning, and we have presented about 2 papers. I would be very interested to share. But our initial study was mainly about how it was perceived by the different contexts Probably it's one paper you might be interested in reading, but and I would be more interested in seeing also how best we can dig deeper into the contextualization of socio-emotional learning in the Ugandan context. And given that we have multiple contexts even in Uganda, because what is in Kampala is not what you're going to find in Luka. So thank you very much.
Thank you so much, Mr. Henry. So we have a question for the research team and on sampling, and one for Dr. Mitana on contextualization and looking at various studies that are already existing. Hosea and Caroline, would you like to respond to the 3 questions? Then we can take a few more. I've seen there, and there's also more down here. So let's hear first from Hosea, and then we can take 2 more questions, and Dr. Mitana can weigh in on the aspect of contextualization once we are done with that bit. Thank you.
Thank you so much. I'll start with the first question about some of the recommendations drawing from the findings. As you're aware, the Rsel was done by 2023. And I will not be talking about recommendations, but I'll talk about what we've done at policy level. At policy level, you know that Child Health and Development Center led the development of the Ugandan national standards that inform parenting interventions in the country. Because previously, just like the school setting, in a school setting there is a standard that when you're going to teach, this is what you should follow. And that was working in the space of parenting. So drawing from our experience, we decided to work with the Ministry of Gender to make sure that we have now, currently, the Ugandan national standards that inform or guide people that deliver parenting interventions in the country. And we also supported the Ministry of Gender with the support from UNICEF to do the Uganda National Parenting Manual and Facilitators Guide. Why? Because from the mapping that was done, we realized that in Uganda we had about 108 parenting programs. And out of the 108 parenting programs, only 2 were informed by evidence. So everyone was just implementing what they think. You read on the internet and you do something. So drawing from the recommendations, we worked with the government to make sure that now we have a guide, at least a manual. It is not informed by evidence, but it draws from the evidence around the field. And also, Child Health led the discussions that happen in Bogota. As you know that Makerere University is working with the Global Parenting Initiatives. We are also a member. So we worked with the team to organize that international conference where Uganda as a country, through the Minister of Youth, makes a commitment to support parenting interventions that are informed by government, at least, and reach half of the parents in Uganda by 2031. And so the data hub that we spoke about, it is also a recommendation, because we need to know who is doing what, when, and how. And then the capacity building, the course. One of the things we realize that when we talk about evidence, people think that monitoring reports, when you go to monitor your activities, that is evidence. So it was important to make sure that the stakeholders, especially practitioners, understand how do I carefully gather data to make sure that I am contributing to evidence. So that course that is continuing to run, it is also drawing from the recommendations that we've been gathering during the time of delivering the work that we do. So we hope that in the next 3 years, we'll be able to reach more practitioners, more policymakers with the knowledge and skills around, building evidence and designing interventions that are informed by evidence. And then the question was, what best practices, what led to what we see? That we reached 2,160 parents were kept on the trial. And so what made it possible? One is drawing from what motivates all parents to parent, is what we would tell parents. Because we came in at a time when there was a lot of child protection work being done. There was a lot of response. So many stakeholders were doing response to people's challenges. So when we drawing from the study that Dr. Sue Godfrey done, which was answering the question, what makes parents to love to parent? It was respect. So when we would go to communities, we would tell them, do you need to have a child that respects you? I'm sure here every father would say yes. Do you want your wife to respect you? They would say yes. Then we ask the wives, do you want your husbands to respect you? They would say yes. Do you want to have children that are respectful? They will say yes. So the program draws from the internal motivation around parenting, and that is the concept of respect. In Africa, it is very important. In the outside world, we'll be challenged that respect, when women respect, we are undermining who a woman is. But we know that for us in Africa, this is something that we hold with a lot of what? Deep feelings around there. So when you tell the men that the women will respect you, then they will want to learn. Because the program came at a time when there was like, if you don't respect children's rights, you'll be beaten. So for us, we knew that we needed children's rights to be respected, but in a different way. So then I'll tell you, bond well with your child, discipline them better, relate better as husband and wife, and respect each other by addressing the 4 risk factors that we spoke about. So that made people to run and sign up for the program. So many times when we are selling the program to a community, many programs send the junior staff. So for us, we sent the senior staff. People who understand the program so well should be the people to sell the program out there. And also, in a way you model. You cannot be talking about parenting when you actually appear like you're someone who can most likely steal someone's husband. So that is also important. Who do you sell? How are they packaged by individuals? That is important. You know, you're going to Luuka. Then you're talking about parenting. Then you're sending a young girl. She's dressed the what? The mukundi is out. Everything is out. She's shining. Then the men may want to come, but the women will tell the men, don't go. So all these small things that we think were important. Then also, how do you work with local government? Many of us, when they tell us to work with the local government, we say, local governments, they want money, isn't it? But you realize that many times there are people who actually want to influence the field. So we took time. It is a process of ensuring that this person, Ozea, who works with local government, loves your program like it is. You can even make calls when you're not talking about the program. Finding out DCDO, how are you this week? What is happening? I'm just checking. So there are informal and informal relationships. You need to build those relationships. Because when you're not there, who is actually telling the parents to attend the weekly session 16 times? It is the CDO. So if you did not create a relationship with the CDO, formally and informally, that person might not motivate the participants to stay online. So that goes into how you mobilize. To retain people, how did you mobilize them? And who mobilized? Who was engaged? When you go to the northern Uganda, did you make sure that you use the clan heads? Were their views respected? How do you agree on timeline? Do you choose to take your program when it is farming time? Do you choose to use the LC and leave the rote query? So all these factors are very important. So we were able to achieve what we achieved because of 1, mobilization and networking, advocacy. Hosea said, sing the same song until when everyone is singing it. So when you're singing parenting for respectability, okulera n'okuza abaana mu ngeri eweebwa ekitiibwa, keep singing it. And also look relevant to what you're speaking. Don't look like you're the opposite of actually what you're selling. Package your information in the way that is understood by the local communities. Walk the journey their way. Don't force them to walk the journey your way. Provide capacity building right from the grassroots. because Carol, Hosea, Betty are not going to multiply themselves. But make sure local government is able to multiply the Carols and the Bettys down there and provide the quality training and capacity building. I've seen partners. The budget says training for 5 days, you want to save. So you do training for 2 days. You realize what kind of materials do parents need. There will be organizations that will do photocopy. But we receive feedback and parents say we want manuals that are colored because we can easily follow. So invest in material development, invest in illustrations, make the facilitation simple, let it be, and let it relate to the real life where this child, where the parent, where the leaders reside. Thank you.
Thank you so much, Caroline. Yes, I don't know if Hosea has something to add.
I have one
Please
addition
be brief.
on
Yes.
retention on the RCT. The formative up to the RCT, we are focusing on the same districts, Wachiso and Amur. So our presence was always there, and all what Kara has said has been done to make people really say there's something good for us in here. So you don't do the formative evaluation in Kamuli, then do the RCT in Iluka. Focus in one area, but let you be known for good things. The co-creation aspect is quite key. Make these people as important to see where you are going. The next generation that you are going to, don't go as an academician. Go as a local person, sit with them, follow their lead, but you know what you are looking for. But then, our colleague here is from our from one of the implementers. But in our presentation, first we said we work within the people's mindset. When you bring husband and wife in the same space, talk about parenting, they're going to collide. So what we did, the first 9 sessions is single sex, women alone, men alone. Let them vent off first and agree that actually this husband is useful or this wife is useful, such that when you bring them together for the next 6 sessions, at least they can agree on the line, looking at the value of the family. So this is also another trick we use to bring people together. Because if the husband beat the wife today, and tomorrow you want them to be in the same space, they won't be there. But until this husband knows the value of the wife, that's when he can now meet. So Albert has an experience in Tanzania.
Thank you. I think for me, one of the ways in the retention has been, like Carol said, in terms of mobilization, who do you put first? One of the challenges was men retention. And our partners in Tanzania, for instance, they decided to have men mobilize. They have what they call fathers on duty. Just as fathers, they go around mobilizing other men, be part of their program. And we have seen in that area, fathers get involved in the parenting program consequently. In northern Uganda, where we are doing it in Lira, the men say, my birthday, I cannot go to the session without Hosea. So we'll make sure that each time we go for the session, I have Hosea. And we have seen also that one, the retention of men in the program has been high rather than where they are not doing it. So the mobilization is key, how you design your strategies to retain the participants.
Thank you so much. And I'll take 2 more questions because I look forward to finishing this launch by 2 p.m. How about that? So we will have 2 more questions. And if you feel what you wanted to ask has already been responded to, you can skip. So I will take 2 from this side and 1 from there, this front part. So modern, back there, and then there, and we should wrap up the questions. Thank you.
Thank you. I would like to appreciate the presenters for the wonderful presentation. This is Medi D.S. Bujiri. Mine goes to Rsel. Which specific intervention do you have on issues to do with learners with special needs? Because remember, in schools we are looking at inclusiveness in schools. So I would like to know the intervention that you have in regard to school inclusiveness. Then two, on the issue of reintegration of teenage mothers in schools, we have a policy on board that talks of reintegrating these teen mothers back in schools. So I'd like to know the intervention that you're going to put across as well in making sure that these mothers are reintegrated back in schools. Thank you.
Thank you so much, DIS Bujiri. I believe this is for Dr. Mitana. Matters on inclusion for learners with special needs and also teenage mothers and all that. Yes, Moda.
Thank you very much. Good afternoon, team. My name is Modern Karma from Star Education. I have two comments, one question to Dr. Mitana. Since everybody has asked the research team, I think I'll deal with the panel. I'll give my comments to the panel. The first comment I have is to the gentleman from the Ministry of Education, the issue of the teachers as first responders versus health centers as the new almost first responders. The reason why that is important to me is because I'm a villager. I come from Isinjiro. And the health center that is nearby, the primary and secondary school, has about 2 nurses and 1 person that we call doctor, but is actually a medical assistant, who is usually never there, and the 2 nurses, their main job is to inject people or look after pregnant women. My question is, what is the capacity of the nurses to look after the schools that are around there? And so the counter question to that is, what if we dealt with a scenario where we we create champion teachers in schools whose capacity we build to actually be the first responders, other than outsourcing it to a nearby health center, where 1, we don't have the capacity, but 2, may not even have the ability to be that first responder. Because if my child is sick mentally in a school, by the time that child has been identified by the teacher, to go to that health center, we might be dealing with an emergency. So issues of mental health are, you see, and also my child is not going to talk to a nurse whom he or she has never seen. So how does a nurse in a nearby health center comfortably talk to a child whom they have never met? So think about that one. The second one is the issue of culture being dynamic. As I grow older, I studied sociology at Makerere, and I was told that culture is dynamic. As I've grown older, I've realized that actually it is not culture, it is dynamic, it is the operating context that ends up being dynamic. Where I come from, in the south, there is a grouping that where it was allowed then that if a man has gone to graze cows, any of the brothers, including the father of the man who has gone, can comfortably sleep with the girl, the woman in this case. Now, that has changed, not because the culture has changed, but because HIV has come. Potentially you can kill the whole family by simply sustaining that culture. So what has changed is not the culture, it is the operating environment. And I think that's something that we need to think through as civil society from the context of what is our pitch. You are trying to solve the issue of FGM. Are you saying that it is bad, or are you showing people that the context has changed and therefore you cannot keep on doing this to women? We run a risk of potentially being the poor seen to be promoting Western values, yet actually in actual sense we are saying something that is legitimate, and we can comfortably take it on from the context point of view, not from this culture should stop. The same would apply to the issue of going to the bush. There is no bush for starters. So the context has changed. So we could pitch the context, not necessarily the culture. My last, which is the question, is to Dr. Mitana. Star Education would be interested in the last pillar on scale and sustainability. The question would be, after this session, what is the plan? How would people who are in this room know? When would the meetings be happening? Is it we call you, whoever is interested calls you or the team, and then we get to know when the next meeting will be? Like, what is the plan beyond this session, and how do partners potentially work with GEMAC on taking this on? Thank you.
Thank you so much, Modern, for reminding us that culture is not really dynamic. It is the dynamics that or the operating ways that are in there. So Modern has 2 questions for the panelists. Please look at the synergy between nurses and teachers as first responders. And Dr. Mitana, you will address the issue of sustainability alongside the other question on context. Let's have the last question.
Yes, thank you very much. I'm called Dr. Irene Mwenyango, and I work as an Assistant Commissioner for Adolescent and School Health, Ministry of Health. I'll start by appreciating the team. J-Mark. Why the fact that a lot has been done. Initially, you are interfacing with the education, but now you realize to solve the education issues for adolescents, we need a multi-sectoral approach. And I would also like to just to add my voice to the panelists this morning. The government has done a lot in trying to see that we work together. A case in point, they have established the Human Capital Development Program, which draws key sectors. This is all in a bid to see that the multi-sectoral approach is implemented. They plan together, they budget together, and the resources are split. Secondly, as a health and gender and education, we are implementing the teenage pregnancy surveillance and response model. This is to implement the national strategy to end child marriage and teenage pregnancy, because we are aware that child marriage, teenage pregnancy is not a gender issue. It is a cross-cutting issue that affects the key line ministries. A lot has been spoken about the framework, that is the national framework on education for health and life skills. The process of developing this framework was multi-sectoral. So I must say there are baby steps. Definitely we need to learn. Putting silos aside and working together as MDAs is a process, and we need to acknowledge that fact. At subnational, we have the DICA, for example. This is the District Committee on Adolescent Health. What is it doing, and who are represented? The different departments: community development, education, and health, name it. So there is some attempt to working together in a multi-sectoral way rather than in silos. Now I have a question for Dr. Mitana. As he was spelling out who does what, I had Ministry of Education is represented, Ministry of Gender is represented, but I feel maybe I missed it. I didn't hear health, yet we are drumming multi-sectoral. Otherwise, I thank you and back.
Thank you so much, Dr. Irene, for your input to the aspects of multi-sectoralism when it comes to this program, and also highlighting the issue of the teenage pregnancy surveillance and response, and also how the District Committee on Adolescent Health can be brought on board. I know the Ministry of Health is a partner, and we look forward to how we will collaborate now that you're here. And I know your other colleagues have also been in the meeting, some left, but let's see how we continue to work together, because when we talk of sexual reproductive health rights, it's an issue that touches on health aspects, and we would love to have the support of the ministry. I would invite Dr. Betty to just respond a bit on the aspects that Modern talked about, and then Dr. Mitana will come in to respond to the questions on the Rsel program, and he will invite our representative of the guest of honor to support us in launching the program.
Thank you so much. Modern, you'll forgive me if I didn't capture everything that you said, but there was a question you exited with. Star Education would be interested in the scale element. What would be the next steps? in the capacity of somebody involved in the study, I think beyond this engagement, there'll be another reach out to people or potential partners who have expressed interest in collaborating. Because we designed this study with the mindset of collaboration right from the start, co-creation right from the start. So there's going to be a platform where the partners with interest, solid interest, based on their expertise, will engage in deciding what we do next. Because this year is going to focus mainly on the protocol material development, what is going to guide the study over the next few years. I liked your observation on culture. A lot of times, we keep saying culture changes. This culture is a problem. And as we were talking in the panel there, I remember making a statement that culture would shift according to the dynamics, okay, of our times. It is the times in which we live that guide how we operate. A lot of times when I'm talking to communities, especially on, let's give an example of FGM. They'll say, we have invested a lot. Nothing changes. Then the question would ask them is, when you go to the community and say you want to root out FGM, what exactly are you telling them? You are calling it female genital mutilation. In the culture, they call it female circumcision. You are actually not communicating. You are not making sense in culture. So we have to understand the perspectives from which people do the things they do and how they are grounded in it. That is why Parenting for Respectability, the research and intervention, has thrived, because it is homegrown, it is informed by the Ugandan understanding of what parenting is. And it is the reason why the word respectability sits in the program. That is the main selling point for everything we do around this intervention. So teachers, I find a problem with teachers as first responders as well, because they are not trained in mental health. They are not experts. Many of them are very subject specific, and they may end up mishandling a case. What is the ministry going to do to ensure that actually our curriculum or curricula are fit for purpose? To do exactly what we need to do in terms of responding to the mental health needs of the children we teach. And we should not wait for adolescents. This should be through the life course. Some children carry trauma right from nursery school because of how they entered the school system. How a parent comes and leaves this child in school, because maybe the way they have been raising this child has created insecure attachment. Carol was talking about bonding and attachment. Those are some of the things we teach parents early. When your child grows up with insecure attachment, by the time they come into school entry, there is a problem. These are the children who cling and cry, mommy is going, they will weep and wail the whole day. There is trauma already there. So how are we going to prepare our teachers from pre-service to understand how to identify cases and maybe refer? Okay? Probably that is the element of response that teachers can have. But teachers also need to be adept in social-emotional intelligence. Most of our teachers do not have any understanding of trauma-informed teaching. Pedagogy has not covered that for them. Normally in teacher education, we say how a teacher enters the classroom is more important than the content he carries. If that teacher was beaten by the husband yesterday, comes to class with that anger, this child who has walked 10 miles to reach the school is late, what is that teacher likely to say to this child? You are always late. They do not understand the context. What delayed that child? The distance is one. Maybe they are caring for a sick parent. Do you have the intelligence to understand how to approach a child who seems to be a problem child in your class, who has a problem? Those are some of the preventative measures that can happen in the schools. But having them handle mental health issues is gaslighting. It will not work for me. Thank you.
Thank you so much, Dr. Betty, for sharing your insights and trying your best to respond to aspects of questions raised by Modern and the other speakers with their additions. I will now invite Dr. Mitana to share briefly on how we plan to go on about scalability and sustainability, as well as our approach to contextualization on social emotional learning in the Ugandan context.
Thank you so much. What I want to say is that we have a protocol that we have submitted the REC for ethical approval. This gives us a skeleton of engagement, a plan of engagement for this year. So part of the contextualization and adaptation process will involve, again, all of us. And the question which was asked, that what is the roadmap, asked by Modern, how shall we know how to be engaged? After here, there is a questionnaire that would be served to all of us that have attended. And at the end, the last question is, if you are interested, where are you interested, and who is the contact, and how often can you? So when you answer that, then we shall get back to you. Then it is from there that we shall begin to form the committees that I mentioned earlier in the presentation to move forward. And then it is this committee again that will make its own work plan to see how to push this forward. So we intend to have this conversation from now up to December, and one of the key outputs of this engagement, this conversation for the whole year, is the pilot plan. Then the other one is the partnership and scale-up plan. So again, we shall be together to see who will be doing what. For example, if we in these discussions, I remember we talked about many pillars, and we discovered that maybe STAR education could lead better in teacher agency and well-being. We shall see how it will lead us there. And then you remember we have talked about the 3 ministries to be engaged. Again, we shall develop a framework. How will these 3 ministries work together? And that's why we talked about the National Advisory Group that will be comprised of the key people from these ministries that will be delegated by the mother ministries. So we have to engage the Ministry of Education, the Ministry of Gender, and the Ministry of Health. And then they give us the people who will sit on this to ensure, again, that this program does not divert from the national framework that the ministries have already put across. So kindly, when you see that link, fill it up, and then we shall get back to you with the next way forward. To the DIS from Bujiri, about the question of teenage mothers, if we have a program that deals with them, we have another sister program that is more or less this one, but it deals with the older adolescents in secondary schools, but is an in-school program. And so we don't deal with those who are out of school, unfortunately, but we are open to conversations again. I know soon we shall come to Ujiri for a meeting at the district, so we can have a conversation and see where are these teenage mothers? Are they in the communities? Are they in schools? But also in that program, remember, we have the parenting and community engagement, and maybe that we can see how they can be incorporated there. But as GEMAC, being a research center, we are always learning and open to new ideas. So we don't say we don't go there. We say we shall learn with you how we can reach them there. But at the moment, we don't. About the Rsel, how inclusive it is, especially with the special needs, we don't have a component that deals with the core special needs. When I talk about the core, I mean those who maybe were permanently blind or permanently deaf. We don't have that, but we try as much as possible to be inclusive, that each one is inclusive. So since we deal with the inclusive schools, we don't deal with the special schools. So any ideas or any cases that we feel that maybe they are beyond us, then we refer to other organizations or other entities that can deal better with them. The same applies to issues of health. When we are dealing with the mental health, then we refer to the medical people, health centers who can give specialized treatment, because we are not medical people. Okay? And some of these issues are the ones which I discuss again as we develop further our protocols and implementation for the next 3 years, and that's why we are here. With that, allow me to respond to, there is a question or concern from Dr. Irene Mwenyango from the Ministry of Health. The Ministry of Health is one of the key partners that we intend to work with, and therefore we cannot do without you. And we appreciate your coming, and we shall have further conversations beyond this to see how we can make this happen. Because as I said, we are dealing with one big animal, but with 3 heads. And some of the heads could be gender, others educational, others are health. So with this, allow me to invite, first of all, before I invite them, I want to thank you very much for sparing your time, your busy schedules, to come to attend and listen to our plan, our launch, our dream for this program. And I know some of you could be fasting, as Daniel said. We are in Lent, then also we are in the holy month of Ramadan. So in case you are fasting, but at least you cannot fast from transport, so there will be your transport refund. Unless you're also fasting from it, you can also tell us, and then we shall also know. But at least pass by that table as you go, so that you can get your transport. At this moment, allow me then to invite the Sheila and the team to organize that for the launch, and I will invite Mr. Moses Musingo, who is representing the PS, the Minister of Education and Sports. And I also invite Dr. Irene Mwenyango, representing the Minister of Health, to come forward. And we have this program launched, first of all, as a gesture of working together as an intersectoral program. But also as a gesture that together we have seen this program start, and together we shall see it to the completion. I hand over to Sheila to do the rest. Thank you.
Thank you so much, Dr. Mitana. And thank you all for staying here until this moment. I would like to recognize Mr. Patrick Walubengo, who's online and has been there for hours. And he's from the International Development Research Center, IDRC. Patrick, if you have any questions, any remarks that you would love to share with us, we look forward to engaging with you. and just seeing to it that we find various aspects of collaboration and synergies as we implement the Rsel program. I will invite Dr. Mitana to join that team. He's already speaking to them, but they will help us to officially launch the Resilience and Social Emotional Learning, in short, Rsel program. Daniel and Yora, you will help me to forward the 2 banners towards the center. Mabel, stay ready with the other tools that you're holding. So, Mr. Musingo, maybe you can just share a few remarks, and the person playing the national anthem for the Republic of Uganda, please stay ready. We will play that as we do the launch. You're welcome, Mr. Musingo.
Thank you very much. Is this Sheila? Yes. Nice to meet you.
Thank you.
Good afternoon, ladies and gentlemen. On behalf of Minister of Education and Sports, and on behalf of the Human Capital Development Pillar, that includes Minister of Health and Minister of Gender, I've seen some colleagues from Minister of Gender on the side, we'd like to, one, thank you for the great work you've done on these 2 presentations that we've had here today, but also to express the apologies that have come from the Permanent Secretary's office. I remember there was a doctor here who was talking about how we should coordinate better. I was asking who was in touch with the office to ensure that the PS had programmed to be here on time, but it seems we missed a link somewhere, but she has sent in her apologies. And while I had come to represent the Department of Government Secondary Education, I have quickly reinvented myself to as well represent the ministry. My name is Moses Musingo Maena. I am Assistant Commissioner, Government Secondary Education. We have 2 departments for secondary education. One is private schools and one is for government secondary. Government secondary is about 1,521 secondary schools, and for private, there are over 4,000, which now are under the restructuring of public service being merged into one department. So, again, to register the appreciation of government to JMAC, as it's an abbreviation, I think. I've not got it, but also to the other partners that are in the house today for the focus on human capital development in terms of education, but also health, and at both the school and the communities. As Minister of Education, our mandate is very clear. It is ensuring that there is provision, there is equitable provision of quality education to all Ugandans. And the Constitution requires us that we should work with stakeholders to ensure the provision of that quality education. And therefore, when you come on board like this, we welcome you. We welcome all the interventions, and indeed, we view education not as biology or indeed history, but as a holistic endeavor to ensure to develop the entire human person. And that is, we know in our programming that we are developing the head, we are developing the hands, we are developing the heart, and indeed you can add, we are developing the soul. And that's what we consider as holistic education. But the focus on sexual reproductive health and mental health are very critical at this particular time. One, as the discussion about the dynamism or the lack of it of culture has been going on, we know that, and this is indeed sometimes a common saying, but it's more, perhaps it's truer today than ever before, that young people are grappling with a lot of fast-paced changes in the world, that they need a lot of support and guidance to go through and flourish. What was the word that JMAC used? And thrive. And thrive. So we welcome all partners in this area. And as, again, Dr. Irene was explaining earlier on, that the government has done a bit in trying to ensure that indeed education is holistic, but also our young people are growing up healthy and mentally health as well. And that is why, again, at the risk of repeating what has already been said, that's why we developed the National Framework for Education on Health and life skills. And I've appreciated I call him Dr. Vian. Dr. Vian has been with us a lot at around Ministry of Education, doing a lot of work for us. I appreciate the acknowledgement that when you are doing this, you need to work within the existing frameworks, the existing standards, and even the existing materials. And where you have to develop materials, it is very important that you work with our technical teams to develop those materials, but also take the materials through the approval processes, because again, it is the mandate of the ministries, health, education, and gender, to ensure that the materials that go to our young people, or indeed to our people in general, adhere to the standards, but as well as adhering to the national values and the national ethos. Culture, yes, changes, but we also need to guide how culture changes. Otherwise, we can be lost as a people. That's also very important. As we appreciate, we have one or two concerns that I would like to draw your attention to, especially in the education sector. And this is something that we have talked with a number of you, that down there in the schools, Bwana DIS, he will tell you this, that there is, and maybe this is because of limited coordination. When I came in, the panel was really having a very interesting discussion. I benefited a lot from it, about coordination and working together in harmony. But down there has been what we call interventions fatigue, where schools have a timetable. They are supposed to have lessons from morning to a certain time, but you have 5, even 10 different organizations within the school, sometimes doing very much related or even similar things, and taking the time of these learners. So that intervention fatigue is also down there. And I'm saying for us as the ministries, but also for us as Ministry of Education responsible for schools, we are working on a framework to ensure that we do not duplicate these interventions and we do not fatigue schools on the programs that they are supposed to be doing. So we are working on improving coordination of interventions in schools, but also, as already indicated, on standardization of related materials and issues. There's been an ongoing discussion that intrigued me today, and the balance between our teacher, how do you bring our teachers into this? And our concern is some interventions have tended to try to replace the teacher. That should never happen. The teacher in a school should not be replaced. And that is why for us, the most consequential interventions and those that are going to be resilient and last and have impact are those that empower the head teacher to do the things that we are talking about should be done. Our training, teacher training, if it were a deal, doctor, it would cover those concerns you said, trauma and everything. We know the gaps in our teacher training. And indeed, that's where, as partners, you need to come in to support us, to bring, because when you empower a teacher, I think it was Modern was talking about it, the teacher is with these learners from morning, in some cases in boarding schools, for example, even during the night. And if you have taken your message to the school and talked to the learners for 30 minutes, and then they have to interact with the teacher for the whole day, and even at night, if that teacher is not empowered, what you have taught or what has been learned from your presentation can be unlearned very quickly. And therefore, empowering the teacher to do these interventions is very critical. And I'm again happy, I noted that indeed, in Rsel, the teacher stands out, but we need to see more of that. Lastly, the issue of evidence-based. It's very nice sounding, but we have had experiences in the past where evidence has been also used, self-generated evidence has also been used to promote our own program. Not necessarily because it works, but that we wanted to do something to prove that to the government that it works. And that's why I was intrigued again to hear somebody talk about the consortium, the concept of consortium, coming together and generating this evidence that cuts across the different projects we're implementing, so that if the recommendation for policy comes from what can I say, from all contexts. I think somebody mentioned about context. Luca kept coming up, Luca as opposed to Kampala. I don't know why Luca. Bwana DIS, are you from Luka or Bujiri? Bujiri has challenges. From Luka, yes. Yeah, dear Luka, yes, my brother. Yeah. So in other words, evidence should be comprehensive. I remember that book, How to Lie with Statistics. So we do not want evidence that is biased to promote a particular project. With these few remarks, I would like to conclude by saying, as Minister of Education, and indeed as the Human Capital Development Program, we welcome you, we welcome the project, and we recommend that we should continue working together within the national frameworks and standards and values to promote interventions that are going to promote our people. And I'd like to invite my colleague from Minister of, I saw some colleagues from Minister of Gender. Why don't they step up also? Did I say a lady from Minister of Gender? Or they were not invited? Or they stepped out already? Yeah, but I'd like to invite Dr. Irene Nyango to join me in unveiling. I'm advisedly avoiding the word launching for one reason. That to launch a program like this on behalf of Minister of Education means that I've been given authorization by even the Minister responsible for education. And we have not coordinated enough to have the approvals from the different ministries. So we are unveiling this project or this program and committing to working together to bring it to practice. Thank you very much, Doctor.
Thank you so much, Mr. Msingo. Dr. Irene Wanyongo, Dr. Mitana, kindly join Mr. Msingo at the front and help us in unveiling the Resilience and Social Emotional Learning Rsel program.
Yes, Dr. Wanyongo has just reminded me, it's a recommendation I'd made, perhaps not very directly, but the recommendation as we unveil is that this should be presented through the existing structures. We have the school health technical working group that we coordinate between Minister of Health, Minister of Gender, and Minister of Education. So we'd like to ask we can agree and get a time program when you present to us. But again, there are also ministry-specific structures that need to do the approvals if you are going to roll this in schools but also in the communities. So we recommend that we take those steps, and we shall guide along the way. Thank you very much.
Okay, thank you so much. Shall we have the Uganda National Anthem, and I will invite all of us to stand. Yeah, the photographers are guiding us on how we will move. I hope the video team is also okay. Thank you very much. Shall we play the anthem as we unveil the Rsel program? It's all right. I am advised that we sing it last when...
Yes, Sheila, we cannot do actions as we are singing the national anthem. We are supposed to be quiet and composed. Thank you.
Okay. Thank you so much.
So, on behalf of the Human Capital Development Program of the Government of Uganda, I'd like to be joined by my colleague from Ministry of Health to officially unveil the Rsel program. Thank you.
Thank you so much. Ladies and gentlemen, JM Education and Research Center is happy to present the Resilience and Social Emotional Learning Program to address mental health challenges and improve sexual reproductive health rights decision making among adolescents in Uganda. A special recognition for our technical partners, the World Health Organization, our funders, Echidna Giving, and the support from the Republic of Uganda through the 3 ministries that we will be working closely with, and all our partners. Thank you so much. for being part of this unveiling, and we look forward to working with you. We have the blessings of our board of directors, our vice chair of the board, Dr. Annette Mugisha, who's also a co-principal investigator, was with us in the morning, and so we have the blessings of the JMAC board as well, and the other team, the other co-principal investigator is here, and I know and trust that as our partners in this room, you're ready to walk this journey with us. Thank you very much. Now we will have a moment to sing the national anthem as we come to a close of this event. Thank you so much. Thank you so much. Mr. Msingo, Dr. Irene, and Dr. Mitana, please just stay there for a photo. And then the rest of us, we plan for a group photo. Don't go for the transport that was mentioned yet. And lunch, Susan has lunch coupons for those who are not fasting. Please, let's make our way here for a group photo. Thank you all very much for making time to be with us until this moment. Those who joined online up to 12 p.m., Dr. Irene Nyamu, the CEO of Really Africa, Dr. John Mugo, the Executive Director of Zizi Africa Foundation, now unveiling Mizizi Elimu Africa, and working even more with partners. Thank you so much for joining us. Patrick Walugembe, IDRC, thank you so much for joining us. Bastian Sherry from WHO headquarters in Geneva, thank you for joining us. The teachers from Bujiri and Luka who joined us online, thank you. The Regional Education Learning Initiative team from Kenya, thank you for joining us. Let's make our way to the front for the group photo. I'm sure this is done, so let's all join them for the group photo. Thank you.